So as we are all set, we'll quickly have a countdown. So let's have all eyes on the LED screen. Thank you so much. Once again, a very good morning and a warm welcome to all the distinguished ladies and gentlemen who have joined us here today for the ABP Desam Health Conclave 2025. Can we give this spectacular event a resounding round of applause? Come on, everybody, let's put our hands together. Thank you so much. Very firstly, we would like to thank our partners, Rinalix and Otrivin, and our learning partner, Malareddy Vishwa Vidyapeeth. Can we give our partners a round of applause? Thank you. So I know we are all set for the interesting lineup we have today. Our all speakers are here with us. But before that, it's time for me to do a quick energizer here. Let me see how's the energy today. Everybody, can you put your right hand up? Everybody in the house. Thank you. Can you put your left hand up? Okay, perfect. So now, let's take the energy level from low to high, exactly how you just told good morning. So now when the energy level is down there, I want you all to give a slow round of applause. And as my hand goes up in the air, I want you all to increase the tone and give an energetic round of applause. Can we do that? Yes? Thank you so much. Let's do this. Put your hands together. A little low, a little low, a little low. Come on. And full high, louder, come on. Okay, thank you. Thank you so much. Let's keep the same energy flowing, but now on the reverse order. Thank you so much. So ladies and gentlemen, as we all begin, the very first session for today, which is Digital Pulse Rewiring Medical Education in Telangana. Please put your hands together as I invite our esteemed speaker, Dr. A. Narendra Kumar, Director of Medical Education, Telangana. Let's welcome sir with a round of applause as he's all set to take over the podium and share his valuable insights. Thank you so much. So sir is here with us. And now let's put our hands together. Let's invite the moderator, Nageshwara Rao. Can we give him a round of applause as well? Requesting sir to join us. It's going to be an interesting session with sir starting off with a speech.
Welcome all to the second edition of ABP Desam's Health Conclave. So here with us, Dr. A. Narendra Kumar, renowned pediatric surgeon in India, and now Director of Medical Education, Telangana. So, sir, over the 30 years of experience in medical field, and he is leading one of the best system in India in terms of medical education. So, sir wanted to share his vision of Telangana's medical education. So, sir.
Thank you. Distinguished guests, respected colleagues, dear students, and members of the press. Good morning to all of you. And it's a privilege to present my views before you on a very important topic, that is integration of technology in medical education in Telangana. So today, our Honorable Minister, Sri Damodar Raja Narasimha, the Minister for Health, Medical and Family Welfare, is supposed to come, but because of some unavoidable circumstances, I am representing his presence and also on behalf of the government. So the medical education and healthcare is expanding exponentially throughout the world. With the advances paralleled by the technology, this technology, if it is integrated, it helps the students in many ways. the retention of the knowledge will be good. Our brain can remember the matter to a short period, but not long. But if it is in a color mode or a digital mode format, the retention capacity will be more and the understanding capacity will be more. So that is the main concept for which the advances in technology is taking the medical field to a higher heights. This technology is now being utilized from simple diagnostics to treatment plans, follow-ups, not only in medical education, but also in clinical applications. There are many things which are happening. The government of Telangana and the Director of Medical Education, we are aware of these developments which are happening outside. And we are not only aware, we are actively investing in this field. And in many ways, we are on running parallel with the advances which are happening outside. So the stimulus for this digital integration in medical education started long back with the NMC integrating the e-learning in the curriculum. The second is Telangana Digital Mission, which wants all fields involvement of the integration of the technology. And the National Educational Policy 2020, integrating advances in higher educations, and also the Ayushman Bharat Digital Mission, ABDM, started by the center. All these things, that is the stimulus which has started a few years back, which are the seed for the integration of the technology in medical education. There are three things which are mainly revolutionizing the medical education as far as technology is concerned. One is virtual reality platforms. Second one is artificial intelligence. Third is digital health records. And fourth, we can take it, telemedicine also is a part of this digital and technology-driven tools which are helping us in medical education and clinical services. If you take the virtual reality, it is amazing and also mesmerizing thing. It is like a fun for a student to learn. It is interactive and the retention capacity will be more. The government of Telangana is planning to introduce smart classrooms, 4 classrooms for each medical college. In all 34 medical colleges, we are planning to introduce the smart classrooms. These classrooms are equipped with all the tools which are interactive boards and also the tools which are required for the smart classrooms. The virtual tables, particularly the platforms which are used for anatomy, the TGMIDC, which is the procurement board for the government of Telangana, the Telangana Medical Infrastructure Development Corporation, through which the things are procured for medical colleges, is in consultation with the international players for virtual anatomy tables. These tables, which gives a space orientation and also a graphic representation of each and minute anatomical details, is useful for various departments, not only anatomy. It will be useful for surgery, it will be used for orthopedics, it will be used for surgical endocrinology, surgical gastroenterology. So the students and postgraduates of these specialties can get exposed to these virtual anatomy tables. These platforms are in negotiable stage and we are going to procure, at least in some of the medical colleges, virtual anatomy tables, which can be utilized by various various specialities in the medical education. The other thing which is revolutionizing the medical education is the artificial intelligence. The sky is the limit for artificial intelligence. It is used in diagnosis, it is used in treatment planning, it is used in follow-up. So everywhere at any step in the delivery of the clinical care, you name it, the artificial intelligence presence is there. The government of Telangana is concentrating through Department of Medical Education on 3 core areas for utilizing the artificial intelligence. The first one is the mass screening of the public for non-cirrhotic fatty liver, NCFL. One of the non-communicable diseases, NCDs, which are bothering the society along with diabetes and hypertension, is non-cirrhotic fatty liver. So this non-cirrhotic fatty liver, if it is not detected at an early stage, it can lead to cell damage, cirrhosis, and finally end up in hepatocellular cancer. Oh, it is the need of the hour because it is alarmingly rising in general public. So we are calling the artificial intelligence leaders in detection of NCFL at an early stage. So by blood tests and non-invasive tests, this non-cirrhotic fatty liver can be detected at early. So this is going to help not only the patients and also the trainees and students to get exposed to these advances in technology, which is useful for patient care. The other core area where the government of Telangana and Director of Medical Education is working is early detection of clinical sepsis. So once the clinical sepsis starts in a patient, it progresses rapidly and it doesn't give us time to treat them, and most of them will end up in mortality. So if we detect the clinical sepsis at a critical time, 6 to 8 hours before the patient goes into a fulminant sepsis, it is going to help the patient and we can save many lives. So the government is in touch with some of the corporate hospitals where the software, the AI-driven modules are there for detection of early detection of sepsis. In that line, the government is working. So this is going to be a real game changer in the care of the sick patients. If we feed the blood tests, if we feed other investigations, the AI can give us an information that within 6 hours or 8 hours down the line, this patient is going to land in fulminant sepsis. So that is the most important aspect which is required for us to save many lives. The other modality which the government of Telangana and Department of Medical Education is planning to take care is the use of AI in radiology. Radiologists are extremely busy and they are rare commodity nowadays. We are finding it difficult to recruit radiologists because there is a large demand in the private setups. So they are busy with ultrasounds, they are busy with conventional X-rays, they are busy with contrast studies, CT, MRI readings. So they have minimum time, limited time to see a conventional X-rays. Suppose if we feed a large volume of X-rays which are coming up in different medical colleges in Telangana state. So these AI modules, they screen the normal X-rays. So out of the large volume, 10 to 20% of the X-rays which are abnormal can be seen by specialists and they can order the next line of investigations by the clinicians. So in that sense, the artificial intelligence use in AI, in radiology, the government and the DMA is planning to introduce shortly. So these are the three core areas: the early detection of clinical sepsis, the screening of plain X-rays from various medical colleges, and also screening of non-cirrhotic fatty liver. These are the three things, core areas, which are presently we are planning to use the AI, which is going to help the students, postgraduates, and finally to the society. The third and the most important, which is since a long time, which is there in government setup, is the telemedicine facilities. There are many advances now coming up in telemedicine. We have a number of hub and spoke model institutes. If you take the neonatology, there are many neonatal units in districts, but the neonatologists are available only at the Nilofer Hospital or in the Hyderabad only. So the center of excellence is the Nilofer and Gandhi, and they will monitor through telemedicine the neonatal centers in the periphery. So they can make a virtual rounds through this telemedicine facility. The same thing will happen with the dialysis units. Every district has got a dialysis units, but the dialysis nephrology facilities are available only at the center. So hub and spoke models, using this telemedicine, we can get the services even to the remote areas. Same, the radiology also, if any radiology services are required to the remote areas, the telemedicine is going to help. The other thing is maintenance of the digital health records. Once the NMC took over, they made the HMIS system, Hospital Management Information System, compulsory. The IP, OP, surgeries, minor and major deliveries, even deaths has to be registered. And this is a good system introduced by the NMC, which is already being introduced in all the government hospitals. And HMIS system and Ayushman Bharat digital mission, there are many things for tracking the health records. So this helps the students to learn about the documentation and also the healthcare facilities which are available. The another good thing which is going to happen shortly is digital health card for all the residents in the state of Telangana. This is the vision of our Honorable Chief Minister, and the Department of Medical and Health and the DMA department is working towards digitalizing the health records of all residents. And this is also going to help our students to, when they go for a family adoption, even with a simple card, they can know the health status of the residents of Telangana. So these are the few instances I am quoting. So the government of Telangana and Department of Medical Education is aware of the happenings outside. Not only aware, we are investing. We are in the process of digitalizing the medical education. We wanted our students not only to get the certificate, come out clinically competent, they should be digitally confident. So this is the aim of our government. This is the aim of our Director of Medical Education. And thanks for all for your patient hearing of my vision about the digitalization integration in medical education. Thank you.
Thank you very much, sir. Actually, Minister of Health supposed to come here. So due to unavoidable situation, he might not come. So on behalf of Telangana government, Director of Medical Education, sir, తెలంగాణ మెడికల్ డిపార్ట్మెంట్ విజన్ని ఆవిష్కరించారు. యాక్చువల్గా ఏబీపీ నెట్వర్క్ తరపున, సో ఆన్ బిహాఫ్ ఆఫ్ ఏబీపీ నెట్వర్క్ ఇట్ ఈస్ కండక్టింగ్, బట్ ఫర్ తెలుగు ఆడియన్స్ ఏబీపీ దేశం కోసం సార్తో ఒక చిన్న ఇంటరాక్షన్ తెలుగులో ఉంటుంది. సార్ థ్యాంక్ యూ. సో వీఆర్ రన్నింగ్ లేట్, సో దట్ ఐ విల్ టచ్ ఫ్యూ టాపిక్స్ ఓన్లీ. సో వన్ ఆఫ్ ద ఇంపార్టెంట్ థింగ్, సో తెలంగాణ ఈజ్ ద ఓన్లీ స్టేట్ దట్ హ్యాస్, అంటే ఓన్లీ తెలంగాణలో ప్రతి జిల్లాకి ఒక మెడికల్ కాలేజ్. దట్ ఈస్ ద గవర్నమెంట్ ఆఫ్ ఇండియాస్ విజన్. సో ఆ విజన్ని అచీవ్ చేసినటువంటి ఫస్ట్ స్టేట్ తెలంగాణ. సో ఇక్కడ అందరూ కూడా మెడికల్ స్టూడెంట్స్ ఉన్నారు. దట్ ఈస్ ద అచీవ్మెంట్ ఫర్ తెలంగాణ గవర్నమెంట్. ప్లీజ్ బిగ్ రౌండ్ ఆఫ్ అప్లాస్ ఫర్ దట్, ఫర్ ద గవర్నమెంట్. రైట్ సార్, తెలంగాణ స్టేట్ సైజుకి, అంటే ఇట్స్ నాట్ ఎ బిగ్ స్టేట్ లైక్ మహారాష్ట్ర ఆర్ ఉత్తరప్రదేశ్. సో ఎవ్రీ స్టేట్కి ఒక మెడికల్ కాలేజ్ అండ్ 9,000 మెడికల్ సీట్స్ మీరు కేటర్ చేస్తున్నారు. ఎలా సాధ్యమైంది ఇది?
అందరికీ శుభోదయం. ఇప్పుడు మీరు చెప్పినట్లుగా తెలంగాణ అనేది ఆఫ్టర్ సపరేషన్ తర్వాత వన్ ఆఫ్ ది స్మాలర్ స్టేట్స్ ఇన్ ద కంట్రీ విత్ లెస్ పాపులేషన్. ఒక పర్టికులర్ విజన్తో ఈచ్ మెడికల్ కాలేజ్ ఫర్ ఏ డిస్ట్రిక్ట్ అనే కాన్సెప్ట్తో ప్రభుత్వాలు పనిచేసి ఈ మెడికల్ కాలేజెస్ అనే ఒక కళని సాకారం చేసినాయి. వీటికి ఒక లాంగ్ టర్మ్ విజన్ ఉన్నది. మనం కోవిడ్-19లో చూసాం, మెడికల్ ఫెసిలిటీస్ కోసం పబ్లిక్ ఎట్లా సఫర్ అయ్యారు. ఆ టైంలో నుంచే ఈ కాన్సెప్ట్ డెవలప్ అయింది. హెల్త్ కేర్ ప్రొఫెషనల్ నెంబర్ని మనం ఇంక్రీజ్ చేసి సొసైటీకి హెల్త్ కేర్ ప్రొఫెషనల్ కాన్ఫిడెన్స్ అనేది ఇవ్వాలి అనేది. సో ఇట్లా మెడికల్ కాలేజెస్ స్టార్ట్ చేయటం వల్ల 2 అడ్వాంటేజెస్ ఉంటాయి. ఒకటి, విద్యార్థుల కళ సాకారం అవుతుంది. ఎంతోమంది విద్యార్థులు కానీ పేరెంట్స్ కానీ తమ పిల్లలు మెడిసిన్ చదవాలి, అది కూడా మనకి నియరెస్ట్ మెడికల్ కాలేజీలో ఇంటి నుండి వెళ్ళి చదువుకోవాలనే ఒక కళ ఈస్ట్ డిస్ట్రిక్ట్లో పెట్టడం వల్ల నెంబర్ ఆఫ్ సీట్స్ పెరగటం స్టూడెంట్స్కి అడ్వాంటేజ్గా ఉంటుంది. దగ్గరలో వాళ్ళ డిస్ట్రిక్ట్లోనే రావటం అనేది పేరెంట్స్కి ఆనందంగా ఉంటుంది. ఈ విధంగా స్టూడెంట్స్ ఒక కళ సాకారం చేయటానికి ఇది ఉపయోగపడుతుంది. రెండోది, రిమోట్ ప్లేసెస్లో కూడా ఈ రోజున ఏదైతే అండర్ గ్రాడ్యుయేట్ కోర్సెస్ని ఇస్తున్న మెడికల్ కాలేజెస్ త్వరలోనే పోస్ట్ గ్రాడ్యుయేట్ లెవెల్కి ఎదుగుతాయి. ఆ తర్వాత సూపర్ స్పెషాలిటీ సర్వీసెస్ వస్తాయి. దీనివల్ల రిమోట్ ఏరియాస్లో కూడా హెల్త్ కేర్ ఫెసిలిటీస్ అనేవి రీచ్ అవ్వటానికి అవకాశం ఉంటుంది.
సో లాస్ట్ ఇయర్ 4,000 మోర్ దాన్ 4,000 సీట్స్ స్టేక్స్లో ఇబ్బంది అయింది ఎన్ఎంసి క్యాన్సిలేషన్ చేసేటువంటి పరిస్థితిలో. సో వీ రిటైన్ దట్ టు రిటైన్ దట్ సీట్స్ మనం చాలా వేగంగా న్యూ కాలేజెస్ స్టార్ట్ చేయడం జరిగింది. ఎలా 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 ఆ విజన్ ఎలా చేశారు?
అంటే మనకి ఇప్పుడు 34 మెడికల్ కాలేజెస్ ఉన్నాయండి. కొడంగల్ అనేది మనం ఎల్ఓపికి అప్లై చేసాం, అది కూడా మనకి మోస్ట్లీ వస్తుంది. సో 35 మెడికల్ కాలేజెస్. ఈ మెడికల్ కాలేజెస్ని ఎవ్రీ ఇయర్ నీట్ ఎగ్జామ్ జరిగిన తర్వాత స్టూడెంట్స్ జాయిన్ అవటానికి ముందు క్లాసెస్ సెప్టెంబర్ 1 నుంచి స్టార్ట్ అవుతాయి. ఈ జాయిన్ అయ్యే ముందు ఎన్ఎంసి విల్ మేక్ ఇన్స్పెక్షన్స్. వాళ్ళు ఆ క్రైటీరియాకి సూట్ అవుతున్నారా లేదా అనేది చూసి షోకాజ్ నోటీసెస్ అనేవి మనకి ఇష్యూ చేయటం జరుగుతుంది. ఈ సంవత్సరం 26 గవర్నమెంట్ మెడికల్ కాలేజెస్కి షోకాజ్ నోటీసెస్ వచ్చినాయి. బట్ వన్ గుడ్ థింగ్ ఏంటంటే ప్రభుత్వ సహకారం, చీఫ్ మినిస్టర్ గారి దగ్గర నుంచి, ఆనరబుల్ హెల్త్ మినిస్టర్ గారి దగ్గర నుంచి, హెల్త్ సెక్రటరీ చొరవతో ఈ క్రెడిట్ అంతా కూడా మన హెల్త్ సెక్రటరీ గారు డాక్టర్ క్రిస్టినా జోంగ్తు మేడంకి దక్కుతుంది. వెరీ ఫాస్ట్ యాక్టింగ్తో మనం వాళ్ళు ఇచ్చిన షోకాజ్ నోటీసెస్కి వాళ్ళలో మనం కాన్ఫిడెన్స్ నింపగలిగాం ఎన్ఎంసీకి. సో ఏ విధంగా నింపగలిగాము అంటే, ఒకటి 3 to 5 years డౌన్ ద లైన్ ఇన్ఫ్రాస్ట్రక్చర్ ఏ విధంగా డెవలప్ చేయబోతున్నాము, అన్ని కొత్త మెడికల్ కాలేజెస్కి న్యూ బిల్డింగ్స్, స్టూడెంట్ హాస్టల్స్, ఫ్యాకల్టీస్ ఏ విధంగా బిల్డ్ చేయబోతున్నాము అనేది యాక్షన్ ప్లాన్ చూపించాం. రెండోది, ఈ ఫ్యాకల్టీ డెఫిషియన్సీని కరెక్ట్ చేయటానికి సో ప్రమోషన్స్ స్టార్ట్ చేస్తాం. ప్రొఫెసర్స్ టు ఎడిషనల్ డైరెక్టర్స్గా చేసి వాళ్ళని ఇన్స్టిట్యూషన్స్కి హెడ్స్గా పెట్టడం జరిగింది. అదేవిధంగా 300 ప్రొఫెసర్స్ని ప్రమోట్ చేసాం, అసోసియేట్ ప్రొఫెసర్స్. 2000 అసిస్టెంట్ ప్రొఫెసర్స్ రిక్రూట్మెంట్స్కి రిలాక్సేషన్స్ తీసుకుని జీవోస్ రెడీ చేసి, ఇవన్నీ కూడా చాలా ఫాస్ట్గా యాక్ట్ చేయటం, గవర్నమెంట్ జీవోస్ రిలీజ్ చేయటం. ఒక జీవో అయితే అర్ధరాత్రి 1 గంటకి సెక్రటరియట్లో ప్రిపేర్ అయింది. సో అంత ఫాస్ట్గా యాక్ట్ చేయటం. దెన్ వీ గాన్ టు ద ఢిల్లీ ఎన్ఎంసీని మన యాక్షన్ ప్లాన్తో వాళ్ళు కన్విన్స్ అయ్యి ఒక స్ట్రక్చర్డ్ ప్లాన్తో వాళ్ళని యాక్సెప్ట్ చేసి ఒక్క రూపీ మనకు పనిష్మెంట్ లేకుండా ఈ ఆల్ మెడికల్ కాలేజెస్ 34 ఒక్క సీటు కూడా పోకుండా చేయగలిగాం.
దట్ ఈస్ రియలీ గ్రేట్. ఎందుకంటే 4000 సీట్లు కాపాడడం అంటే చాలామంది మిడిల్ క్లాస్ స్టూడెంట్స్కి
అంటే అది
చదువుకోవడానికి అవకాశం
స్టేట్కి లాసే కాకుండా యాస్పిరెంట్ స్టూడెంట్స్ కూడా ఒక సీటు పోయినా కూడా అది లాస్ ఉంటుంది. ఆ ఆస్పెక్ట్లోనే గవర్నమెంట్ త్వరగా స్పందించింది, ఎన్ఎంసీని కన్విన్స్ చేసింది. మనం వీ కుడ్ ఏబుల్ టు రిటైన్ ఆల్ సీట్స్ ఇన్ ద గవర్నమెంట్ సెటప్స్.
మెడికల్ ఎడ్యుకేషన్ వరకు చాలా ఫుల్ ప్రూఫ్గా చేస్తున్నారు. సో అటాచ్డ్ కాలేజెస్, మెడికల్ కాలేజ్కి అటాచ్గా ఉండేటువంటి టీచింగ్ హాస్పిటల్స్లో సో వరల్డ్ క్లాస్ స్టాండర్డ్స్ అనేవి మనకి ఉన్నాయా? ఎందుకు అంటే చాలా రిమోట్ ఏరియాస్లో మనం ఇప్పుడు మెడికల్ కాలేజ్, సపోజ్ యూ మెన్షన్ అబౌట్ కొడంగల్, అలాంటి చోట కానీ వాటికి అనుబంధంగా వచ్చేటువంటి టీచింగ్ హాస్పిటల్స్ అనేవి ఆ స్టాండర్డ్స్లో మనం మెయింటైన్ చేయగలిగేటువంటి ఫెసిలిటీ ఉందా?
సో ఒక మెడికల్ ఎడ్యుకేషన్ ఇన్స్టిట్యూషన్కి స్టాండర్డ్స్ మనం చూడాలి అంటే ఇన్ఫ్రాస్ట్రక్చర్ చూడాలి, ఫ్యాకల్టీ చూడాలి, క్లినికల్ లోడ్ చూడాలి, ల్యాబ్ ఇన్వెస్టిగేషన్స్ ఏం జరుగుతున్నాయో చూడాలి, వాళ్ళ దగ్గర జరిగే ఎకడమిక్ యాక్టివిటీస్ అవి చూడాలి. సో ఇప్పుడు మనకున్న 34 కాలేజెస్లో ఇన్ఫ్రాస్ట్రక్చర్ వైజ్ చూసుకుంటే కొన్ని కాలేజెస్ ఇంకా ఇన్ఫ్రాస్ట్రక్చర్ స్టిల్ ఒక 4 కాలేజెస్ ప్రైవేట్ బిల్డింగ్స్లో ఉన్నాయి. సో వీ హ్యావ్ అన్ యాక్షన్ ప్లాన్. 3 to 5 years డౌన్ ద లైన్ all medical colleges will move to their own places. All NMC guidelines ప్రకారమే ఒకే ప్లేస్లో మెడికల్ కాలేజ్, హాస్పిటల్, హాస్టల్స్, ఫ్యాకల్టీ రూమ్స్, నర్సింగ్ కాలేజ్, ఎలైడ్ హెల్త్ సైన్సెస్ కాలేజెస్ అన్నీ ఒకే క్యాంపస్లో, ఒక 30 acre క్యాంపస్లో ఉండే యాక్షన్ ప్లాన్ అనేది గవర్నమెంట్ వద్ద ఉన్నది. సో ఇన్ఫ్రాస్ట్రక్చర్ వైజ్ ఇట్ టేక్స్ సమ్ టైమ్ బికాస్ ఇన్ని మెడికల్ కాలేజెస్ షార్ట్ పీరియడ్లో స్టార్ట్ చేయటం వల్ల కొన్ని టీచింగ్ ప్రాబ్లమ్స్ ఉంటాయి. వీఆర్ షార్ట్లీ గోయింగ్ టు ఓవర్కమ్ దట్ అండ్ వీఆర్ ఆల్రెడీ ఇన్ ద ప్రాసెస్ ఆఫ్ కరెక్టింగ్ ద ఫ్యాకల్టీ డెఫిషియన్సీ. అకాడమిక్ వీఆర్ ఫాలోయింగ్ ద ఎన్ఎంసీ గైడ్ లైన్. దర్ ఈజ్ ఎ యూనిఫామ్ academics throughout the country.
One certain phenomena అంటే అందరూ విజిబుల్ ఇది, గవర్నమెంట్ కాలేజ్లో చదువుతాము కానీ గవర్నమెంట్ హాస్పిటల్లో పనిచేయం. సో అప్కమింగ్ మెడికల్ స్టూడెంట్స్ కానివ్వండి, లేకపోతే మెడికల్ ప్రొఫెషనల్స్ పైన కామన్గా నార్మల్ పబ్లిక్ చేసేటువంటి కామెంట్ ఇది. అంటే మీకు చదువుకోవడానికి గవర్నమెంట్ కాలేజ్ కావాలి, పని చేయడానికి గవర్నమెంట్ హాస్పిటల్ వద్దా అనేది. సో ఈ కామెంట్ని వాళ్ళందరినీ రిప్రజెంట్ చేసేటువంటి హెడ్ ఆఫ్ ది ఇన్స్టిట్యూషన్గా మీరు ఎలా డీల్ చేస్తారు?
మీరన్నది కొంతవరకు అది కరెక్టే. మోస్ట్ ఆఫ్ ది స్టూడెంట్స్ కానీ పేరెంట్స్ కానీ గవర్నమెంట్ మెడికల్ కాలేజ్, ప్రైవేట్ మెడికల్ కాలేజ్ ఇస్తే మొట్టమొదటిగా గవర్నమెంట్ మెడికల్ కాలేజ్ని ప్రిఫర్ చేస్తారు. గవర్నమెంట్ సీటు దొరకనప్పుడే మనం ప్రైవేట్ కోసం చూస్తారు. దీనికి మొట్టమొదటి కారణం ఒకటి సీనియర్ ఫ్యాకల్టీ, మంచి టీచర్స్ గవర్నమెంట్లో ఉంటారు అన్న ఇది. రెండోది క్లినికల్ లోడ్. మనం ఒకసారి వైద్య విద్యను చూసుకుంటే 80% వి లెర్న్ ఆన్ క్లినికల్. ఒక పేషెంట్ మీద 80% లెర్నింగ్ ఉంటుంది, 20% ఈజ్ ఫ్రమ్ ది థియరీ. మనకి గవర్నమెంట్ అండ్ ప్రైవేట్ చూసుకున్నప్పుడు గవర్నమెంట్లో హ్యూజ్ క్లినికల్ లోడ్ ఉంటుంది కంపేర్ టు ప్రైవేట్. ఈ రెండు కారణాల వల్ల ప్లస్ ఫీజెస్ తక్కువ ఉండటం వల్ల పేరెంట్స్ విల్ ప్రిఫర్ ద గవర్నమెంట్ కాలేజెస్. అదే మనం ఉద్యోగానికి వచ్చినప్పుడు ఇదే క్లినికల్ లోడ్ చూసి భయపడతారు. ఇంత క్లినికల్ లోడ్ని మనం తట్టుకోగలమా? లిమిటెడ్ రిసోర్సెస్, దెర్ ఈజ్ ఎ ఫ్యాకల్టీ అంటే కెరీర్ అడ్వాన్స్మెంట్, ఫ్యాకల్టీ స్టాగ్నేషన్ ఉంటుంది నెంబర్ ఆఫ్ మెడికల్ కాలేజెస్ తక్కువ ఉండటం వల్ల. అండ్ దెన్ రిమోట్ ఏరియాస్లో పనిచేయాలంటే వాళ్ళకి రెసిడెన్షియల్ ప్రాబ్లమ్స్ ఉంటాయి. సో ఈ కొన్ని అప్రహెన్షన్స్ వల్ల కొంత ప్రీవియస్ ఇయర్స్లో, కానీ ఇప్పుడు ట్రెండ్ మారింది. సో నా అడ్వైస్ స్టూడెంట్స్కి, మీరు ఫీల్ ప్రౌడ్ ఫర్ వర్కింగ్ ఇన్ ఏ గవర్నమెంట్ సెటప్. ఇట్ ఈస్ అన్ ఆనర్ టు వర్క్ ఫర్ ద గవర్నమెంట్. It is like serving to the, giving back to the society. God has given you an opportunity. Many students want to become a doctors, but God has blessed you. You have to give back to the society. One way of giving back to society is joining the government service and serving the poor. Previously, ippatiki government service lo there are lot of changes. Government is counseling method ద్వారా selection చేస్తుంది. మీరు ఎక్కడైతే మీరు ఇష్టంగా పనిచేస్తారో అక్కడే మీరు చూస్ చేసుకోవచ్చు. సెకండ్, ది రెన్యూమరేషన్స్ హ్యావ్ ఇంక్రీజ్డ్. అవర్ శాలరీస్ ఆర్ వన్ ఆఫ్ ది బెస్ట్ ఇన్ ద సౌత్ ఇండియా. థర్డ్, ఇన్ఫ్రాస్ట్రక్చర్. మీరు ఇప్పుడు చూశారు ఇన్ఫ్రాస్ట్రక్చర్ అనేది హౌ గవర్నమెంట్ ఈజ్ గోయింగ్ టు ఇంప్రూవ్ అండ్ డిజిటలైజ్ ద హెల్త్ కేర్ సిస్టమ్. దెర్ ఈజ్ ఎ ప్రపోజల్ టు హ్యావ్ రెసిడెన్షియల్ క్వార్టర్స్ ఇన్ ద రిమోట్ ఏరియాస్. There is a proposal pending with the CM for incentives for those who are working in tribal and remote areas. So all these real, genuine hurdles is most of them are relieved, and remaining few are also going to be removed. So you are most welcome to join once you complete your courses and serve the state and serve the public.
ఇప్పటికీ కూడా మెడికల్ ఫీల్డ్ అంటే వెళ్ళడం అనేది, మెడికల్ ఫీల్డ్లోకి వెళ్ళడం అనేది మోస్ట్ ఆస్పైరింగ్ థింగ్ అనమాట ఇప్పటికీ స్టిల్. బట్ ఇది బయట వాళ్ళకి. బట్ మెడిసిన్లో ఉన్న వాళ్ళకి, చదువుకునే స్టూడెంట్స్ కావచ్చు, ఎవరైనా కావచ్చు, మెడిసిన్లో సెట్ అవ్వడం అనేది చాలా చాలా టైం టేకింగ్. చాలామంది ఈ మధ్యకాలంలో చాలామంది మెడికల్ స్టూడెంట్స్ నుంచి వస్తున్నటువంటి ఫ్రస్ట్రేషన్ వి అబ్జర్వ్. అంటే 4 ఏళ్ళు ఎంబీబీఎస్ చదివి హౌస్ సర్జన్సీ చేసి మళ్ళీ పీజీ చేసి, పీజీ తర్వాత స్పెషలైజేషన్ చేసి వాళ్ళు ఒక పర్ఫెక్ట్ డాక్టర్గా ఒక హాస్పిటల్లోకి వెళ్ళాలంటే ఇట్ టేక్స్ 8 to 9 years. ఆ తర్వాత కూడా ఈవెన్ ప్రైవేట్ హాస్పిటల్లో వాళ్ళకు వస్తున్నటువంటి శాలరీ అనేది వెన్ కంపేర్డ్ టు ఐటీ ప్రొఫెషనల్స్ అండ్ సిఏస్ చాలా లోగా ఉంటుంది. అంటే మేము ఇంత టైం స్పెండ్ చేస్తున్నాం ఇక్కడ, బట్ వీఆర్ నాట్ ఎర్నింగ్ మచ్ అనేది ఉంది. దట్ ఈస్ వై, అదే రీజన్ వల్ల చాలామంది బ్రెయిన్ డ్రైన్ అవుతుంది, మైగ్రేషన్ అవుతుంది అనేది. సో దీని గురించి
సో మనం ఒక స్టూడెంట్ మెడిసిన్ జాయిన్ అవ్వాలి అని అనుకున్నప్పుడు హీ ఈజ్ చూజింగ్ దట్ ప్రొఫెషన్ విత్ ఏ పర్పస్. నేను ఐ వాంటెడ్ టు బికమ్ ఏ హీలర్ ఆఫ్ ది సొసైటీ అనే ఒక కాన్సెప్ట్తో, ఒక పర్పస్తో జాయిన్ అవుతారు. మీరు అన్నట్టుగా మెడిసిన్ 5 years, తర్వాత ఇంటర్న్షిప్, పోస్ట్ గ్రాడ్యుయేషన్ 3 years, మళ్ళీ స్పెషాలిటీ 3 years, సెటిల్ అవటానికి 10 to 12 years అవుతుంది. అదే ఐటీ కంపెనీలోనో 3 to 5 yearsలో దే ఎర్న్ ఏ గుడ్ అమౌంట్ ఆఫ్ శాలరీ. బట్ ద సేమ్ సాటిస్ఫాక్షన్ ఈజ్ నాట్ వాట్ ఏ డాక్టర్ గెట్స్. మన ప్రొఫెషన్ వల్ల మనకొచ్చే రికగ్నిషన్ కానీ, మనకొచ్చే సెల్ఫ్ సాటిస్ఫాక్షన్ కానీ వీ కెనాట్ కంపేర్ విత్ ది అదర్ ప్రొఫెషన్స్. ఈ ఒక విధంగా వాళ్ళు మోర్ కంఫర్టబుల్గా ఉండొచ్చు. వాళ్ళు వర్కింగ్ టైము 5 days a week కానీ, లేకపోతే పర్టికులర్ అవర్స్ ఉండొచ్చు. కానీ డాక్టర్స్కి వచ్చే ప్రొఫెషనల్ సాటిస్ఫాక్షన్ యూ కాంట్ కంపేర్ విత్ ద మనీ. సో ఎనీ స్టూడెంట్ who is entering the medicine, you are joining with a purpose. You want to become a healers of the suffering people. So be in that concept. Don't compare your profession with IT or other professions. We have taken up this And when we are joining, we know that we are exposed to three eyes. Always I tell the students, this is a noble profession, but still there are risks. We are exposed to infections because we deal with the patients. We are exposed to injuries because we deal with instruments. We are exposed to insults. Not all patients will praise you. One or two will become against you. So get prepared for three eyes and don't look at money. There are certain ethics and you are in a noble profession. Don't compare with the other professions.
వన్ ఫైనల్ క్వశ్చన్, మిగతా అన్నీ కూడా మీరు టచ్ చేస్తారు, టెక్నాలజీ ఇంటిగ్రేషన్ అన్నీ మీరు మాట్లాడేశారు, టైం లేదు కాబట్టి వన్ ఫైనల్ క్వశ్చన్. సో సిన్స్ యూ మెన్షన్ అబౌట్ ఎథిక్స్, రీసెంట్గా మనం హైదరాబాద్లో చూసాం ఇన్సిడెంట్స్ ఎలాంటివి వస్తుంది మెడికల్ ప్రొఫెషనల్ ఎథిక్స్కి సంబంధించి. సో ఎథిక్స్ అనేవి ఫెర్టిలిటీ ఇష్యూలో మనం చూసాం, ఎంత ఇంపార్టెంట్ అనేది ఒకసారి
ఎథిక్స్ అనేది అందరి హ్యూమన్ బీయింగ్స్కి అది ఇంపార్టెంట్. ఏ ప్రొఫెషన్లో అయినా ఎథిక్స్ అనేది ఉండాలి. అట్లానే మెడిసిన్లో, కాకపోతే మెడిసిన్లో ఇంకా ఎక్కువ ఎథిక్స్ అనే దానికి ఎక్కువ ఇంపార్టెన్స్ ఇవ్వాలి. సెకండ్, లెర్నింగ్ ఎథిక్స్ అండ్ టీచింగ్ ఎథిక్స్ ఈజ్ ఎ కంటిన్యూస్ ప్రాసెస్. మనకి ఎథిక్స్ ఫస్ట్ నేర్పించాల్సిన వాళ్ళు పేరెంట్స్. వి స్టార్ట్ ఫ్రమ్ అవర్ బర్త్ ఇట్ సెల్ఫ్. ఇంట్లో పెరిగేటప్పుడు ఎథిక్స్ నేర్చుకోవాలి. The second stage where we learn ethics is the schools, our teachers. There are many role models, ethical teachers, which we can take it as a role models in our lives. I can name a few even at this age. Third is ethics in medical education. 2019లో ఎన్ఎంసి అనేది టేక్ ఓవర్ చేసిన తర్వాత కాంపిటెన్సీ బేస్డ్ మెడికల్ ఎడ్యుకేషన్ అనే సిస్టమ్ని తీసుకొచ్చిందండి. దాంట్లో ఎట్కామ్ అనేది ఒకటి ఉన్నది, యాటిట్యూడ్, ఎథిక్స్ అండ్ కమ్యూనికేషన్. ఈ మూడు మెడికల్ గ్రాడ్యుయేట్స్లో ల్యాకింగ్ ఇప్పుడున్న జనరేషన్ అని, దట్ హ్యాస్ గివెన్ అన్ ఇంపార్టెన్స్ టు దట్ ఎట్కామ్. ఈ ఎథిక్స్ అనేది అన్ని స్పెషాలిటీస్లో దెర్ ఆర్ సర్టన్ క్లాసెస్. సో నౌ ద ప్రజెంట్ ఎన్ఎంసి గైడ్లైన్స్, సిబిఎంఈ మెడికల్ కోర్స్, ఎట్కామ్ దాని కింద ఎథిక్స్ అనేది వి రెగ్యులర్లీ టీచ్. అది ఒకటే కాకుండా పర్సనలైజ్డ్గా ఆల్ స్టూడెంట్స్, మై అడ్వైజ్ ఈజ్ యూ కమ్ అక్రాస్ సో మెనీ టీచర్స్ ఇన్ యువర్ లైఫ్. సో చూస్ ద బెస్ట్ వన్స్, మేక్ దెమ్ యాజ్ యువర్ రోల్ మోడల్స్. The teachers who stick to ethics, who stick to the dignity, who stick to the discipline, you make them as role models and use them as your ethical teachers lifelong. This is one profession where ethics should be maintained till we retire. Right?
థ్యాంక్ యూ సార్, థ్యాంక్ యూ వెరీ మచ్.
Thank you so much for an insightful session. And once again, we thank Dr. A. Narendra Kumar for being here with us. మీరు మీ విలువైన సమయాన్ని కేటాయించి ఇక్కడికి వచ్చినందుకు ధన్యవాదాలు. థ్యాంక్ యూ వన్స్ అగైన్. అండ్ విత్ దిస్ ఐ వుడ్ లైక్ టు ఇన్వైట్ మిస్టర్ సుబోధ్ గుప్తా, Director, Inlex Health Systems Private Limited, to the stage to kindly honor Dr. A. Narendra Kumar. Let's welcome sir with a round of applause. So ladies and gentlemen, with this we wrap up our first session and let's proceed to the next one as we all are geared up. The next session, the topic stands, Redesigning Medical Education for Changing World. Let's put our hands together and invite the moderator, Diksha Navani. Very warm welcome to you, Diksha. And now let's put our hands together for the speaker, Dr. Preeti Reddy, Vice Chairman, Malla Reddy, Vishwavidyapith, MBBS MD. I know I'm going to get a louder cheers here. Thank you once again. Requesting you to kindly be seated and let's start off with the session.
So a very good morning, everyone. It's a privilege to be here. A very warm welcome to ABP Desam Health Conclave for a session that couldn't be more relevant today. As the world around us shifts from global pandemics to AI breakthroughs, from climate change to risking mental health concerns, one thing becomes very clear: the way we train our doctors, that no longer can remain the same. Dr. Preeti, as someone shaping the next generation of doctors, let me begin by asking you, when we talk about redesigning medical education for a changing world, what do you think is the most urgent shift that we need to make, maybe starting from today?
Well, before we begin, I would like to say thank you. And it's a privilege to be a part of this high-dose, high-impact health enclave. And thank you to the ABP team that they have invited me. And of course, I would like to congratulate and thank everyone to be a part of this enclave, the doctors, the dignitaries, of course, the very dynamic director of medical education who spoke amazingly. Sir, I'm a fan of yours after when I hear you. I myself learned a lot today when I heard you. And of course, all the dreamers in the room, all the medical students, dental students, each one of you from Allied and the organizers. Well, coming to your question, redesigning medical education is actually the need of the hour, and I feel competence-based learning, faculty development, and basically integration of the technology in education. So not only just medical, dental, all kind of health education is absolutely important because that's the need of the hour. So our students should be not just job ready, but future ready. So that's the plan.
Right, absolutely. And next, I'd like to ask, with rapid advancement, we are now in a world where we are moving alongside AI. We have AI diagnostics, we have robotic surgery, and VR-based learning. How should curriculum designers adapt to this AI technology?
Well, if you see the existing conventional methodology of teaching is quite old, and I feel like, introducing all these words like, artificial intelligence, AR, VR into our routine medical education. So basically you need to have this flexible module of education which is more like, technologically integrated. So if you have the curriculum which is more technologically integrated, so that would make our doctors ready, like, the moment they are out of the MBBS, they know how to use these technologies. So that's a plan.
Right. Private institutions now handle a large share of India's medical education. What role can they play in balancing affordability, quality, and also access, especially for rural students?
Well, I would say, again, the use of artificial intelligence should be implemented using the digital forums, the platforms to educate like the students from the rural background. And of course, as Sir said, that, creating more medical education systems in rural areas where we can get the education system right, which is next door. And of course, the hospitals which are going to come will add on more doctors to the rural areas. So I think this would be a nice way to improve the rural areas, improving their medical education as well as health facilities.
Right. So, Dr. Reddy, we also know that the healthcare sector is not clinical anymore. it has also become entrepreneurial. So how can medical students be empowered to become innovators, researchers, and health tech founders?
Yes, it all depends upon the management of the medical education system, and they need to equally give importance to not just academics, but also to the research, like, creating incubators and, innovation centers. So I feel a medical education should not just be an educational hub, like not only just concentrating on academics, but also research and innovation equally, 50-50%. So that would make their, future better for research and innovation.
Right. So, Dr. Preeti, my next question is actually very important. We have seen a rapid increase in mental health issues. There is stress, there is burnout, there is depression. How do you think medical institutions can actually work on this?
First of all, I would like to say all my students out here, relax. You're not in a war. So you're just enjoying. So you opted to be a dentist or a medical student or whatever stream you choose. It should be out of interest. It's not about forcing you to do that. So please first, before you choose your stream, see to it that you're interested. Number two, you're not in a competition. It's a learning, it's a knowledge which you're acquiring. So at the end of the day, you need to understand, okay, fine, I know the subject, I can use it for my future and for my job and whatever. And of course, it's a learning process, so do not take much stress. And especially for a medical education, for the management, I think they should be supportive. Do not make it a terror area where, the students are entered. And of course, there should be discipline. Discipline is different, terror is different. So discipline with relaxed education, and we have the peer counseling, so that's important.
Correct. So as per you, as per your experience, what is the biggest gap between medical learning, between what they are learning in the institutions and the actual hospital reality?
Okay, well, again, most of the doctors, I have always seen, they are more into theoretical system. They are all just studying, they're studying, but they don't know. So, for example, if we start exposing our students from the first semester or the second semester itself, from the first year itself, so they know they will have more proximity towards the patient, and they will be studying that aspect itself. Basically, I feel that communication is the most important skill of what a doctor should need, and practical exposure. And most importantly, I think when it comes to nowadays, there are a lot of simulation labs also which have been built up in the medical education. So practicing the way to treat a patient on the simulation from the first year and then exposing them to the patients is also a good idea. So that would be they are more well trained to expose to the patients. Yes.
So as per you, you think the current education system is still not updated with the real life scenario in the hospitals?
Of course, yes, because the hospital is demanding something else, to be very frank, and our doctors are actually going in some other direction. But then if you try to inculcate both, if you try to get hospital from the first year of the education, that would be comfortable. I think that would be more I think as Sir said, that 80% of medical education is practical exposure. Absolutely. And theoretical should go hand in hand. So I think even if you see, even in the technological sector, I have seen in abroad, instead of these typical classrooms, they have these small learning areas right next to their incubators. So where they are also understanding, they are industry oriented as well as they are getting educated through classrooms.
So they also get a hand-on experience,
and
they are also learning
experiential learning is the need of the hour. Yes.
Absolutely. With the introduction of the national exit test, how do you see the balance shifting between rote knowledge and clinical competence? Will it raise the quality bar?
Yes, of course, because the shift is required, and focusing more on competence-based learning is the need of the hour. So with the comments of next, I think they will be not, the rote thing will be kept aside, and they will be more understanding. Critical thinking will be adding to your thought process. So there will be, the way of education system will change. Rather than rote, it would be more of critical thinking, I would say.
And that will also increase the quality.
Yes, of course, because you are exposed to the real life challenges, and that will lead to be a better person.
What is your opinion on making internship rotations more focused on preventive and public health exposure rather than just specialty departments?
Of course, very much important because we all finally, after doing the MBBS, most of them opt to do PGs in clinical departments. Agreed. But what is going on, around you in public health? Because finally you are going to treat the patients. If you go to the public area and try to prevent the diseases, means you understand the pulse of what is around you, the public. And then you can be a better doctor. So I think even in any medical education system, like any medical college, should give equal importance for public area interns. Like the interns should be posted and there should be a mandatory posting and training in the public area, like, PHCs. So that's important, and RHTCs. So this is the basic need. And I think the students should also take it very sportively. Believe me, when you are in the urban center, like especially for this MBBS and BDS, that's my experience. I would like to add on this. When I completed my MBBS, and then we were like, oh yes, we completed MBBS, and I was feeling like a doctor, but still my surroundings were not making me feel like a doctor. So then when I went to PHC to do my internship for last 2 months, what a respect which I achieved over there. They were treating me like a super specialist because for them, looking at an MBBS doctor itself is a boon. It's a boon for them. So the moment I entered into the PHCs, the actual feel of a doctor comes you from there. The respect and the honor which they give you, even to the post-MBBS doctors, is better felt in rural than urban. Post-MBBS.
Right. Thank you for sharing that. So Dr. Preeti, there is a coming debate over commercialization of medical education. So how do you think India can strike a balance between innovation and also, meeting the goals there?
It all depends upon the regulatory bodies, I feel. The regulation system, they need to create transparency. And it's very important because, finally, even medical education needs a lot of financial support to run it.
Correct, but you do agree that it is overpriced sometimes?
I won't say it's overpriced, but yes, it should be comfortable.
Right.
Because, even today, if you compare to any other business, people are ready to buy lands, they are ready to buy jewelry. Why not education? Sorry, but that's a fact. The reason is, education is okay, a government sector can provide free, but coming to a private sector, it is important because maintaining the infrastructure, if you compare the government infrastructure and the private infrastructure, sorry to say, sir, there is a difference. But then coming to private infrastructure, to maintain the beauty, if you come to our campus, you will surely get mesmerized by the campus, and to maintain the faculty is equally important, to buy all the equipments, and that too now when I'm telling that we need to improve our digital infrastructure, so buying all the servers, the database and everything, it of course, it's a Herculean task and it needs a lot of financial support. And yes, of course, we need to give scholarships too. The people who are, the students who come from a poor family, unable to study, and along with earning money, we need to also support them by giving a lot of scholarships. So,
well, I think, yes, that is
it's a win-win situation for education and for
that's
us.
a valid point when you say it's not just about commercialization, but you also need the kind of funds to provide the industry-ready facilities to develop the infrastructure.
Yes, and now sir was also talking about adding artificial intelligence and digital health. That itself, getting those digital dissection tables.
Correct.
Nowadays, cadavers are not available in private medical colleges, so we need to buy the digital dissection tables very soon for them to make them understand. So everything needs funds.
True. Absolutely. Well, do you believe private institutions should be mandated to contribute a portion of services like student-run rural health camps or subsidized care to meet national health goals?
As I said already, it's important for every student to look in what is happening in the public sector, because finally they are going to serve the public sector again. So it's important for them during their curriculum to visit the PHCs, to visit the public area, to concentrate on the preventive care, and so that they become better doctors. Like, because we all as doctors, we just don't treat the patients, but we also guide them that this is not to be done. And finally, the data which we receive from the public sector reminds us that in which direction our country is going. Like recently we had COVID, nobody thought. And then later on we understand which sector, which age, like there are different diseases, communicable or non-communicable diseases, which are common in particular gender, in particular age group. This has to be understood at the end of the day so that they become better doctors. So,
post-COVID, we also saw a lot of MBBS students choosing the international pathways. So how do you think India can reverse that trend?
I would just say all the students, please come back. Because India, let me tell you, the way education system is growing in India, no other country is doing that. Believe me. And as Sir was telling about Ayushman digital machine, the ABDM,
right.
And there are so many advancements, the NEP 2020, like, integrating the interdisciplinary learning, which is the need of the hour. Like, why does the doctors or the medicos has to know medicine? Why can't they know AI? Why can't they know the ethics, the law? Everything is getting integrated. So I think interdisciplinary is what they are thinking. Second thing is inclusivity and equity is also like, one of the points in NEP 2020, and flexible learning, multiple exit, multiple entry system. I think these all things, like the moment each and every institute start following these things, it would be very easy for a student to do their MBBS or any education in our country rather than anywhere else. And yes, of course, like, embracing the advanced technology in each and every medical education is equally important, because, and also make the global education available in your doorstep, to your doorstep, so that the students, they don't want to look outside. They will rather believe in our education system than somewhere else.
Right. Okay, so before I ask my next question, I actually have a question for our audience, for all the students here. How many of you think you have all the soft skills needed? Do you think medical knowledge, education is enough, or do you think you also need soft skills? How many of you think you have soft skills? I need to see some hands up, empathy,
come on, students, you need to be confident to say yes or no.
Yes, please be confident. I see 3 hands, 4. Okay, so talking about soft skills, Dr. Preeti, we are in this changing era where these things are also of equal importance. Skills like empathy, communication, ethics. And, we feel that especially in medical education, it is often overlooked. So do you think it should also have its own place in the formal education system?
Of course, yes, because doctors is like, doctors should have the most empathy than any other professional, is because we are more concerned towards care of a patient, and that can come only with empathy. Empathy, being compassionate, being ethical towards what you're doing, because we are dealing with lives, not with machines.
True.
And lives we all have a heart. So we need to also consider that, the feelings of the patient right in front of you, who is like, he's already suffering he's in a pain. And then we need to be, agar hum log compassionate nahi honge, to aur kaun hoga? So doctors need to be the most compassionate people on the earth, I would say. And most importantly is you need to, I feel like a doctor should be with skills, but with soul.
Correct.
So that's important. So do not leave your ethical aspects, do not leave your empathy just to run like, I want to be the best doctor, but you can't be best without having empathy.
Adding to empathy and ethics, do you also think communication is also very important? Because you might be very good in what you do, you might be very good in your practice, but if you lack communication skills, you also somewhere are behind in this changing era.
Yes, of course. That's what I told in the beginning, that communication is highly important. Basically,
Right.
I have seen nowadays everyone, the theoretical knowledge is bharpoor hai unko. Like they have the entire theoretical knowledge feeded in their mind, like maybe because of rote or whatever it is. But finally, when you ask them the questions, even during Viva, they are stuck. They're stuck. I don't know why. It's because lack of exposure to practical knowledge or hands-on training. Finally, we are going to deal not with machines, we are going to deal with human beings. So communication is the most important thing. Talking to your patients, most importantly, getting the history. like history, taking the history from the patients is equally important. We all have been now dependent, like, we are dependent on all the investigations rather than having a word or a dialogue with the patients. Nowadays, I see most of the doctors, they just, whenever they are in the rounds, they hardly talk. They will ask for certain investigations. Examination, even per se, like if you say 10 years back when we were studying, we used to take a proper detailed history. The present symptoms, then the present illness, then the past history, the family history, everything used to be included. So history taking is very important. That will come to, some sort of differential diagnosis. Examination, please touch your patient. Please, try to see the pulse, the BP, your own self, because that is also a part of skill, hands-on training. And then you depend on the equipments to finally come to a diagnosis. So communication and one-to-one
Should go
dialogue
hand in
is
hand.
important.
Yes. How do you personally define a future-ready and industry-ready MBBS graduate? What values should they have?
Well, I think they should be technologically literate, and they should be ethically grounded, and most importantly, compassionate. And they should be community concerned. So these are the characters I would expect a doctor to be.
Right. Lastly, you come from a legacy of leadership and public service. Your father-in-law, Shri Malla Reddy Garu, often inspires students by saying, Palu Ammina, Polu Ammina, highlighting struggle and value. How do you see such real-world philosophies shape the mindset of future doctors?
Well, of course, thank you for taking his name. I always look at him as a visionary. He's been an inspiration to each one of us, especially in education industry. And yes, Palamina, Pulamina is his dialogue, but I think that was then. Now, I don't think so anyone who will just say Palamina and Pulamina will achieve the success what he has achieved, unless you use AI in Palamina and Pulamina. So use your technology even in those areas so that you achieve what it is now. And I think it's easier to be what he is today in this generation. Of course, it's nothing to compare him, but still, I think education is available everywhere. Because of this, utilizing the digital platforms, the AI modules, the AI tools, it's easier to, acquire knowledge wherever you are. So education has become easy. And at the same time, what you need is consistency. The hard work, and everyone talks about we need to work hard, but work hard with a proper disciplined manner. Secondly, work hard in a right direction. Just don't work hard wherever you, in a wrong way. And most importantly is consistency. If you are consistent, I think you can achieve whatever possible.
Absolutely. Well, thank you so much, Dr. Preeti. It was truly an honor to have you here with us at the ABP Desam Health Conclave. A round of applause for Dr. Preeti, everybody. Over to the MC.
Thank you so much, Diksha. And I again thank ABP for inviting me. And thank you to the entire team. I think it's a huge success. Thank you.
Thank you.
We thank the moderator for such a wonderful session, and thank you, Dr. Preeti, for keeping it so impactful. I'm sure the students here are going to take away a lot. Thank you once again, and I would now invite Mr. Sunil Goswami, Editor, Digital Videos, ABP Network, to kindly join us on the stage, and let's honor Dr. Preeti for being here today. So much everybody for joining us here. And now let's step forward to our third session. But before that, let me ask you a question. How many of you find the sessions interesting? Can you put your hands up, please? Let me see how many hands up are in the air. All right, so everybody. Okay, thank you. So ladies and gentlemen, the next session today, the topic stands the future of healthcare how personalized medicine is changing the game. For which, let's put our hands together as I invite the moderator, Dr. Suravi Sharma Kumar, author and health systems management and administration, who works with NGOs to support preventive healthcare for underprivileged communities. Can we give Dr. Suravi Sharma Kumar a huge round of applause? Let's have her to the stage. Now comes the time where we invite our speaker. Put your hands together for Anu Acharya, founder and CEO of Map My Genome, who's awarded as the Young Global Leader by the World Economic Forum in 2011. So let's put our hands together as we dive right into the next session, which is the future of healthcare and how personalized medicine is changing the game.
Hello, good morning, everyone. Our distinguished guests, the whole auditorium full of medical students and other health professionals. And we are here today. I'm so glad to have this opportunity to invite you, to welcome you to this discussion. With one of our experts in the field of personalized medicine. As it's a very futuristic topic, and our previous panels and previous discussions has also touched upon all the technical areas. It's also about the Amy sir and everyone, they were also talking about technology integrated medical education, telemedicine, and all AI in healthcare. So it's already, the discussion has been about transforming healthcare in today's context. And the topic that we are going to discuss is even more futuristic. It is already in place. Already a lot of work has been done in the area of precision medicine. But still yet, it is not fully adopted in clinics, in real life clinics, and is more of a research topic so far, though there are certain areas where it has revolutionized treatment. Healthcare system, as you have understand, healthcare delivery has always been a one-size-fits-all approach. So this one-size-fits-all approach is now, it's time for it to change, and it is changing with the help of genomic studies, where a person's genomics, the genome mapping, and all the genetic details are mapped, and a report is formed where we will see a person's total genetic makeup, like predispositions to genetic disorders, to susceptibility to disease, even his lifestyle choices. Everything is detailed, is available to us nowadays with the help of genomic studies. And these reports help the clinician make the clinical decisions right and unique to that person. So it is not one size fits all anymore. It will be unique treatment for each individual. So like we have one fingerprint, unique fingerprint. Everyone has one fingerprint unique to that person. So it's a genetic imprint, which is very unique to that person. So the treatment will be customized and tailored according to that person. That is the promise of precision medicine. So today we have with us Anuradha Acharya ji, who is an industry leader in this field. And so we will be exploring the topic with her help, and try to understand what is in store for us in near future, or what is already achieved. So Anuji, you want to give a small introduction, or I should come to the questions directly?
Sure. No, first of all, thank you, Dr. Survi, and thank you, ABP, for inviting me here. I think many of everybody is today has heard about DNA and RNA, has heard about things, right? And I think that's part of the excitement about personalized medicine that became a lot more popular during COVID, because pretty much everybody had to do a swab. Pretty much everybody got to understand about variants and things like that. But I think personalized medicine has a lot more capability to be able to help, especially doctors. And today, those of you who are in the medical field, I think will realize that when you graduate, you will be using this pretty much on a day-to-day basis. So it is important that you get more familiar with what we have in the personalized medicine space. And maybe we can talk a little bit more as we go along.
Yeah. So my questions will be, the first question will be very basic. It is about the capability of personalized medicine, because it's something new to the healthcare landscape of the country, maybe globally also. So we'd like to know if I get my genetic imprint, genetic mapping done, or anyone else gets it done, what is the capability we can expect? What is the benefit we can expect out of it? That's a very, very basic thing that is in our minds.
Surely. So I think when you think about what you are getting out of personalized medicine, or when you get a genome test done for anybody, you have to realize that you are basically taking any cell of your body. When you're getting the DNA, we then sequence it to be able to get the data from there. Now, in each of those cells of yours, you have about 3.2 billion base pairs. And when you start looking at the whole genome, that might be a lot of data that might be there today. So I think what you can get today from a genome testing, one could be, when somebody is planning a baby, you want to understand if you're likely to pass on a genetic disorder to a baby. That could be one, right? So you do a carrier screening before you plan a baby. So things like your thalassemia and other recessive disorders, whether those are going to be passed on. So that could be one. The second would be during pregnancy, for instance, you are doing a lot of genetic tests to be able to understand what's going on with the baby's future, right? So you do things like NIPT and others, which are non-invasive tests done today to understand if you're chromosomally and others, if the baby is all right. Now, let's say the baby comes out. You want to understand now whether you want to give them the best nutrition and the best fitness for them. So you can also understand for that particular baby whether certain types of nutritional deficiency is likely to be there in the baby or in the young child. You can also understand if you want to put them in football or any of the other games or cricket, whether they are likely to be a sprint athlete or a marathon runner. So there are things that are more interesting from a behavioral standpoint also. You can understand those, sleep and other things that are there. And then as you go along in your life, you also look at things where you can understand whether you have a risk for predisposition for a particular type of disease, which means that is this person likely to have a risk for type 2 diabetes, risk for a particular type of cancer or anything else. But you can also understand the other determinants of those diseases, right? So for instance, when you look at just cardiovascular diseases, you are also trying to understand if you're likely to have high blood pressure, you're likely to have, you're certainly going to respond to a particular medication like a clopidogrel and others. So I think it is a lot of those different aspects of what you can get out of a genome, and look at the variety of different medicines that you might respond. So do you give them the same dosage? Do you change the medicine and so on? So those would be another set of things that you can look at for personalized medicine. But there are also other fun things like, can you understand where you came from? What are your roots? That might not necessarily come under the realm of healthcare. But I think genomics is an exciting area because you are not just trying to help people treat a particular disease, but you can also now start to understand how do you look at data that comes from your genome and also from microbiome and other things to be able to say, how do you live longer? How do you not age as much? So I think the whole field of longevity and others is also taking shape with these technologies that we have.
So it's not only just disease prevention and treatment, it's much more that we can expect from precision medicine or personalized medicine. At the same time, we would like to know for our knowledge, what is the global best standards achieved so far by any clinician, any oncologist, with the help of personalized medicine. So be it in India or abroad, so there are a couple of conditions that has shown a lot of success in treatment with help of personalized medicine. And those are, as I know, is like cystic fibrosis and some breast cancers and lung cancers. So we would just like to know a few examples from you where a clinician has really made a real life impact using inputs, reports from genomic studies.
So I think if you take India, for example, I think the places where we are seeing the most clear-cut use cases are in the case where you're looking at NIPT, which is when you're planning a baby, that is one, or carrier screening, or diagnosis of rare disorders, right? These are things that have already started taking place. The other thing where we started about 12, 13 years ago was to say that can you understand the predisposition or prevention of a particular disease? Because I think as we go forward, we will start to see that it is not just your specific disease that you are looking at from a treatment with a medicine, but you will also start looking at environment, you'll start looking at food, you'll start looking at fitness, because ultimately those will be what will create the right kind of value for the end user. So I think that's what is there. In the US and many other countries, we are seeing a lot of advancements in the case of cancer. Even in India, I think we are now seeing that a lot of cancer treatments, whether it's immunotherapy or otherwise, or even just chemotherapy, you can look at whether a particular medicine has the right, whether an individual has the right kind of genetic makeup. Based on that, the right medicine is given. And I think that is transforming the way you are looking at the whole aspect of medicine. How do you treat a patient, right? And you don't just treat this, you don't just give the same thing to everybody. Just like we all don't eat the same food, we all don't wear the same clothes. I think each one of us is so unique because our DNA code is unique. And therefore, we have to realize that when we are treating patients, that every individual is different. And therefore, that personalization, whether it's pharmacogenomics, which have also now started, we are seeing a lot of that happening for many specialties. But I would say that the largest where we have seen the most, at least in India, has been psychiatry, cardiology, diabetes, and cancer. Those would be the areas that we've seen, and neurology, of course.
Because every person is unique, and every disease manifestation in different person will be different. It's unique. There's a difference between certain disease, how it manifests in one person than the other person, and how the disease will progress in one person will also vary significantly than another person. Even the treatment response can also change. It can also vary significantly. So all these factors that we can, the clinician or oncologist can take in consideration with the help of genomic studies, and that can tailor make or customize treatment for that particular patient, which definitely is going to be much more potent than a regular one-size-fits-all treatment. So as everyone will agree that the genetic studies have become the words that are like genome sequencing, genome surveillance. All these genetics-related words became very commonplace at the time of COVID. COVID is a time when we first, probably many of us, because I'm a doctor, it's a different case, but otherwise, a common household, for the first time, they got exposed to these words, genomic surveillance, and there is the government of India forming a consortium of genome surveillance consortium, where 10 laboratories were in one chain. So all these things were everywhere in the newspaper. It's the first time, probably there was a good exposure of people, the common people, to genetic advancements that are going on. And there has been decades and decades of studies by people like Anuji, and there are a whole lot of genetic teams world around who are doing research for decades, and now it is at a mature stage. So it is the public health, during the public health emergency is when this came to the fore. So we came to know more about genetic studies only at the time of public health emergency. So we'd like to know from Anuji, like how in public health it can contribute. We know it can control disease outbreak, viral transmission, but is there more to it in the preventive side and also in breaking chain of pandemics and endemics kind of thing? We'd like to, what more can we expect in the public health area?
Certainly. I think for public health, I think there is a lot that can be done. And while you can also look at genetic makeups of your individual constituents as individual people, that would be a very helpful thing from an overall population base as well. But there are other things that can be done on a public health basis. And I think maybe some of you might remember that there were some of these wastewater sequencing that were done as surveillance methods. Similarly, I think if we start sequencing environmental, like your air quality, your microbes in the air, you start to look at the soil and others, I think all of those ultimately have an effect on human health. So there is a huge effect of saying, can we look at not just pathogen sequencing or a host sequencing, which is human beings, but we can also start looking at all the other environmental effects that can come on health, your food effects on health. That's the kind of place where I see the most value in public health. So sequencing for microbes in the air, in the water, in sewage, and everywhere else. That would really help in building a much more stronger surveillance method for the state and the country.
What about us? We have been hearing a lot about this newborn genetic testing, which is made mandatory in different countries. In India also it is done in the private sector, but it's not yet mandatory from government side. So that is also
absolutely. I think you hit upon something that is very essential. And while there are a few Nidan Kendras in India that do the testing for newborns, we can do before newborns as well, right? I mean, ideally, I think we could just do the screening of the couple before they plan a baby, because that's where you can actually prevent a lot of diseases being passed on. So when you look at somebody who is a carrier for things like thalassemia or cystic fibrosis or others, I think if their partner also has that same recessive gene, then there is a problem of passing it on to the child, a risk, and they need to be counseled on that. So I think the 1/4 risk, or if it's an autosomal dominant, then 50% risk, that's essential to be able to communicate to the public that this is something that can be done. And the Nidan Kendras currently are still few and far away, and I think we need to make that as something that is mandatory for everyone. I think we'll start seeing much lesser number of cases of any of these diseases which are potentially preventable for all of us.
So today we have a good number of medical students here. So would you like to just let us know in very simple language, a layman's language, something about genome sequencing? Maybe all our budding doctors will want to know. So just basic of genome sequencing, then things like gene therapy or target therapies. So maybe in very layman's language, just for understanding, very basic understanding. And also we have been hearing a lot about DNA sequencing. Is there is RNA is involved, sequencing is done. So just maybe 2-3 lines you can would
Sure.
like to have.
So I think maybe the simplest way to think about sequencing is like a big recipe book, right? Just think about like this really big volume of 23 chapters of a recipe book with lots of information that is there, with lots of details, right? That's your whole genome. And that would be about 3.2 billion base pairs. So in each cell of your body, when we extract the DNA, that's amount of data that you are getting. Typically, when we are doing like a whole genome sequencing, which would be almost 90 gigabytes of data, there is a huge amount of data that you're gathering, and you think about it as this recipe book with all these 23 chapters that are there, right? Which are basically your chromosomes, if you think about it in that form. And instead of A, B, C, D, E, F, G, H, you can think about the letters that we have as only A, C, T, and G. Those are the 4 letters that we are using. Now, one way is to do the whole genome sequencing, which would mean that you have a lot of data, which would mean a lot of cost, which would mean a lot of analysis. The second, which is the most commonly used by medical doctors, is what we call as the exome sequencing, which is 2% of this whole big recipe book. So think about like this quick fix, like the ones that are most relevant for the clinician. Typically, that's what they would order, right? They order an exome, which would be the functional part of the genome. And normally, when you're trying to diagnose a disease, you're trying to understand that, you're trying to say, okay, I need to know this, I need to understand about this BRCA gene, or I need to understand about the CYP2C19 gene or something else. Typically, sometimes you can just look at those particular genes and be able to be happy with that. And then there is the third type. That's where we do, for instance, in the genome patri, right? Now, this is like going through the entire genome, but you are specifically picking out points from there. So you're looking at markers across the genome, both in the exome, but also in the intronic and the other regions of the genome. But you don't do the 90 GB of data, but you're trying to pick the right ones so that your cost is reduced, your information for the right kind of genes is there, and you're also trying to find how is it going to be relevant for the individual. So that is what would be on the sequencing side. The second thing you asked was, is there something known as the RNA sequencing? It is. It is not yet so popular. It's basically thinking that this recipe book, now you're actually translating, you're actually getting that expression done. So how do you translate from that recipe book into something that you can do the sequencing and get the expression of those particular things? The third thing I think you asked about was on the CRISPR and other.
Yeah, what is CRISPR?
And other.
Is it something therapeutic, or can it be used for intervention purpose, like gene editing and all, or just maybe in a layman's language? Yeah.
So how many of you have heard about CRISPR? A few, at least I saw 2-3 hands. So CRISPR
I think in class 12 curriculum, also in biology, there is some mention of CRISPR.
Okay.
But in the medical MBBS courses, I don't think they have incorporated anything on personal medicine so far. So that is also one big topic. Maybe you can ask a question. Yeah.
So CRISPR, like you have a word editor, similarly, I think CRISPR in a very, very layman terms is more like a tool that allows you to be able to change a particular sequence, right? So it has found a lot of use in diagnostics. It has found a lot of use in actual therapeutics. And it is also, we are starting to see that this is something that in the future we will start seeing a lot more of that. I think by the next 5 to 10 years, you'll see a lot more happening on the CRISPR side, because it allows you to pick very specific regions of that and be able to understand it both from a diagnostic and a therapeutic point of view. So you'll start seeing a lot more trials. If you go today to clinicaltrials.gov or other places, you will see that CRISPR and other editing technologies are finding a lot of, you start seeing a lot of that, along with things like microbiome therapeutics and many more. So there is a lot happening in this field, and I wish that, in the medical education, that these start getting incorporated, because they are the ones who are ultimately going to be using these.
So lastly, that we've been talking about public health, personalized medicine use in public health. So is it going to be cost-effective in healthcare in the long run? Do you think so? Or the initial investment itself is going to be pretty high just to make it, to actually help start an implementation of the precision medicine for public health use? So do you think it's a very cost-effective, it's going to be cost-effective in the long run? Because in comparison to the initial expenditure, I want to ask you.
I think it is extremely cost-effective, because if you think about it, today your cost of any of these genomic tests is not that expensive, right? You start at like 7,000, 8,000 to a little bit more. You're doing this once. You don't have to repeat these genetic tests, right? And that's the beauty, that for most of the genetic testing, you'd have to do it once in their lifetime, unless it is a mutation that has occurred during a cancer or something. Nobody has to repeat it, especially if you have done the whole genome sequencing. So I think let's say that if the government starts to do a sequence like maybe genotyping of a large population, you can prevent adverse effects of like giving the wrong medication. You can prevent, potentially having some, genetic disorders you can prevent. You can, more importantly, I think you can get better, longevity, health span for all these individuals, which basically means your productivity increases, which means your number of people who are healthy, who can contribute is also increasing. So I think even with just taking the monetary value of it, you will see that just by changing the way you are looking at nutritional values for the population or just adverse effects, that itself will pay for doing a personalized medicine exercise for the whole community.
So with this, we are coming to the end of the panel discussion. And I just like to wind up by saying that it's time for the medical students to give some exposure to personalized medicine so that the future doctors are already ready with it and they have enough knowledge to start with the changing landscape of healthcare that is going to come in next 5 to 10 years. And there should be general awareness. We should raise general awareness. ABP channel and all media should work on it, raising general awareness for personalized medicine so that people know what to expect out of it and and they go for it. That is most important. Yeah. Thank you so much. Thank you,
so much.
Anu Acharya-ji.
Thank you so much. We thank our moderator, Dr. Srivi Sharma Kumar, for moderating the session. And also we thank our speaker, Anu Acharya. Thank you once again for sharing your expertise here with us. And to felicitate our speaker, I would request Vidya, Regional Sales Head South, to please join us on the stage. Let's So how many of you around have seen newborn babies? Everybody? Can you put your hands up, please? How many of you have dealt with newborn babies? You've seen at your home or in the hospital anytime? People over here. You've never seen newborn babies? Yeah, you've seen, right? Almost everybody. Okay, let me ask you a quick question. So, after what age do babies start shedding tears? This is a fun fact. So anybody who can let me know, after what age do babies start shedding tears? Anybody? You've seen babies probably at home, at hospital, you've played with them, you've been with them, you've seen them grow. Anybody, any guesses? Come on, give me random guesses, I'm okay with it. There's no prize or there's no acknowledgement here for giving the right answer, but I wondered how many of you know this? 7 days? A little more maybe? Now if I said a little more for 7, I don't need 8 days, please. Come on. A little more, a little more. Thoda aur time dete hain. Come on. 2 weeks? A little more maybe? 21 days? I think this is coming from tradition. Any more answers? People from this side, I haven't heard it from you. 6 to 8 months. No, that's too long, a little too long. 6 to 8 weeks is quite close. Yes? I heard it from there. That's the right answer. It is 1 month, ladies and gentlemen. So it's after 1 month where we see the baby can actually start shedding tears. Let me ask you another question. Again, this is a fun fact, but I wanted to hear it from you. How many square feet is the average adult human skin? Yes? 21 feet is quite close. A little plus or minus would be great. 20, no. I need a little lesser. I got it from here. It is 19. So it is 19 square feet. That's the average adult human skin. So how many of you were aware of it? Did you get to know something new? Yes? All right. Thank you so much. We'll now be proceeding towards our next session. It's quite interesting. We'll be having a fitness coach and wellness consultant joining us. So let me introduce, ladies and gentlemen, the next topic is debunking myths from superfoods to miracle diets. Let's invite our speakers. Let's put our hands together for Urvashi Agarwal, internationally certified fitness coach and nutritionist, and Dr. Lahari Surapaneni, nutritionist and wellness consultant, founder of Nutriful. Can we give both the leading ladies a huge round of applause as they walk up to the stage for our next session?
Hello everyone and good afternoon, and this is actually going to be a very informative and very interactive session. So the topic of our session is superfoods and debunking myths. So let me just start the session by actually asking all of you, how many superfoods do you know and do you eat? Okay, how many of you think that they are eating right, eating healthy? Can you please raise your hands? None of you think that they're eating right. Okay. In the past 1 year, how many have you started having fox nuts, which is also known as makhana? Because now on social media, it is, I can see at least 3-4 hands at the front row and then again at the back. So this is what we are going to discuss today, the myths that we need to debunk about superfoods. So I'll start with you, Urvashi. You know, on social media, we are actually getting to know one or more superfood, so-called superfood, every second day. You know, we watch reels, we watch videos on YouTube, and there's makhana, there's broccoli, there's matcha. Yeah, these days. So are these actually superfoods?
So there is no term as superfood. If we talk about superfood, let me tell you, there is no official nutrition authority like FSSAI, WHO, or FDA, who's come up with any official, legal, or scientific term. It is just a marketing gimmick for people, right, to tell them that certain foods are superior, and by eating them, you can just reverse your unhealthy lifestyle. So that's a breaking news for you. So if you have an unhealthy lifestyle, let's say you have sedentary life with no exercise, no activity, people have processed junk food, erratic sleep cycle, stress is sky high. 2 teaspoons of chia seeds is not going to help you.
Right, right. Coming to you, Dr. Lahiri, do you have clients, do you have patients who comes to you and say, okay, fine, I really want to reverse my aging, and you know, how do I increase my glutathione by having broccoli twice a day, or maybe having chia seed water every early morning? I don't know, I've seen celebrities eating raw garlic early morning, like even before they brush their teeth. Do you think that that is actually going to help people? Again, or is it a social media university myth that people are just blindly following?
So as Survashi has said, there are no superfoods are these, very simple solutions that are going to help you clear off everything or overcome the hurdle that you have built into your lifestyle, usually over a decade. It is like, somebody telling you, most of the times when we see these influencers, right, talking about superfoods, it's like somebody telling you this hat or this piece of jewelry is going to make you look so beautiful without talking about the dressing in the first place, right? The first step to looking good or looking presentable is the dress or your attire. So it's like not talking about anything about the attire and all, and just talking about, oh, this hat is doing all the job. It's as silly as that, as ridiculous as that. However, I'm not saying they do not have any benefits at all, but those benefits do probably add up to about anywhere between 0.1 to 1%. When you're not working on your 99 to 99.9%, these 0.1 to 1%,
you can't rely on.
Yeah, is really not going to make any difference that you can see or you can perceive. So, but problem is most people want these instantaneous results or something that is very easy to do or a step that is going to make them feel like they are doing something without really doing anything that is helpful, with effortless.
Right. So, coming back to you, Urvashi, she just mentioned the word influencer. A lot of us are being just, we are just following the content that is being pushed on social media. Be it Instagram, we are watching reels every day about food, superfood, exercise, fasting, intermittent fasting, keto diet, gluten-free, all of this. Do you think that we should actually follow these followers? Like, do you think that just having 2 million viewers make you credible enough that we should be hearing them or we should be following them? I'm pretty sure that a lot of us would be actually following a lot of influencers like this.
So with the advent of social media, of course, whether you talk about any platform, right, YouTube or Instagram or any other platform, there are influencers. Now, it's okay to influence people, and it's okay to guide people. But my question is, where are the certifications? Where are the degrees? When you talk about, when people follow you, and you talk about, let's talk about a simple topic, exercise, right? Now, if somebody has done a transformation, let's say person X has lost 20 kgs, that does not make him a coach.
Right.
Right? You can't say, okay, I have lost 20 kgs, I can become an influencer and I can help people lose those kgs or that weight. Similarly, same thing is true for nutrition.
Right.
Or any facet of fitness or health. Right? So having millions of followers does not warranty your credibility, your knowledge, your expertise.
Dr. Lahiri, we have also seen on social media that a lot of Western culture influence is now being adopted over here. So especially with our youth, they are going crazy over matcha. Okay, they are going crazy over chia seeds. They are going crazy over different kinds of rotis, not eating rotis at all, amaranth, and there are other substitutes as well, right? So do you actually think that people know what is actually a balanced diet, what actually should be a proper diet? Do you think people actually know about it?
Most of the information, unfortunately, is being assimilated from the information overload that is available all across the media, whether it is print media or social media or any of those places. So whatever is being popularized, whether it is matcha or chia seeds or whatever other fad that is going to or that is here to run its course over the next 6 months to 6 years, it could be anything. All those things really are only temporary relief when there is no assimilation of balanced diet. A lot of people, at least in my clientele, what I see is people think they are eating healthy just because they are following the rules or the guidelines provided by, as Urvashi has said, not necessarily properly credentialed or knowledgeable individuals. So when you derive knowledge from places like that, there are going to be certain gaps. So to answer your question, Most people think they do know what a balanced diet is, but they don't entirely know it. And secondly, a balanced diet is not a one size fit all, right? So it's going to be different at different phases of life, stages of life. It's going to be different for different genders. It's going to be different for people with different lifestyles. Just to give you a simple example, added sugars or just having any kind of sugar on a regular basis is not recommended for general public. Right? However, when you take somebody who is an endurance athlete or an athlete who is constantly on the go and exercising for over 2 to 3 hours a day, one of their main sources of constant energy while they are performing is going to be added sugar. You cannot have a better source of energy that is going to instantaneously give them the outcome they are going to want.
Correct.
So in their case, the sugars or added sugars are part of their balanced diet.
Correct.
So the definition of balanced diet for general public is different from individuals.
Correct.
So here again, personalized nutrition with respect to their genetics as well as their lifestyle in general also comes into picture.
Correct. Urvashi, she just mentioned the word sugar. That reminds me of the recent announcement Sugar and Oil Board has made that, it would be mandatory to announce or, to write the amount of fat, the amount of calories, the amount of sugar and oil that is being used in processed food. Do you think we should also make our children aware at the very early stage? Because even the Sugar and Oil Board is going to promote healthy eating habits in school as well. So how responsible are we, our parents, doctors, teachers, everybody around us? Because the Sugar and Oil Board is doing their work. They're doing their job. But again, it's our duty as well.
So the Union Health Ministry has suggested now that sugar and oil boards are put across, and it started with schools. Like schools will start having sugar and oil boards for the children so that they understand when they look at the board and pictures of their favorite snacks. Some cookies, biscuits, namkeens, packaged cold drinks, packaged soft drinks, juices, right? So children will understand from at a very early stage that what they are actually eating, right? So that's how it started. And this, we have come to this stage because of this obesity, which is a silent epidemic. And the projection is by 2050, we will have 44.9 crore people who will become obese. So
Across ages.
Sorry?
Across ages, different age
Across,
groups.
across ages and in India.
In India.
So that's an alarming statistic. So now children really need to understand. So I think it is high time that we have nutrition a part of their curriculum. It's really, really important. Also, the onus is also on parents. We're putting sugar and oil boards at the schools, right? But
how about creating one at home as well?
How about the parents? Because when junk, processed, packaged food is cheap, it's easily available, heavily marketed, are you going to take time to pack healthy snacks for your children or healthy meals for your children? That's also important.
That's actually an alarming situation because we see kids as young as 7 and 8-year-old and their weight would be like 40, 45. All they are obsessed is with junk food. But how do they develop this habit? Probably people around them are eating all of this, right? But, coming back to the main and the most trending thing, which is actually fasting. It's not just intermittent fasting. I think intermittent fasting would be like early, like 5 years. It's basically a trend that used to happen 5 years from now. Now people are going to try fasting for good 24 hours at a stretch. Do you think that it is actually recommended? They don't even understand that bodies of a man and a woman is actually different, and across age groups is actually different. You can't be fasting for 24 hours straight, but it is all over social media that it reverses your aging.
Yes, this is also one of the trends. However, I would say one of the safer trends really, because fasting is not new to humankind or even to Indian culture in general. when we eat our last meal sometime in the night, until the time we eat again, we are fasting, really, right? So intermittent fasting is just extending that time by a little bit. As you go on doing that, as you keep on extending that, there will be a point where you see a sweet spot where you are comfortable enough, deriving enough energy to support your daily activities. When you are doing any kind of fasting, it should not interfere with your ability to perform any of the tasks. So that part is very important. When people don't consider that, and as you rightly said, it's 24-hour fasting is not for everybody. At the same time, 12-hour fasting is also not for everybody.
Correct.
And there are some people who would go on 72-hour fasting. Sometimes people need to go on 72-hour fasting for therapeutic reasons also.
Right.
So you really can't put a blanket statement saying fasting is good or fasting is bad.
Right.
It's across the scale. There are so many grays in these kind of diets, whether it is fasting, intermittent fasting, whether it is keto diet. So there are several aspects that need to be considered and several caveats to be considered, whether somebody is going to have benefit out of it or it is going to do more harm than benefit. Yes.
Benefit. Okay. In the end, Urvashi, just give us total 4 things or maybe 4 habits what we are doing wrong. Maybe 4 wrong things that we are consuming every day across ages, or maybe 4 habits that we are following every day across ages that is actually harming our body more than doing the benefits, as she mentioned.
So talking about food or you're talking about lifestyle?
Both, including.
Okay. So lifestyle, the first part is going to be the most difficult part. Stop touching your phone the moment you open your eyes. How many of you do that? Sometimes I also do it.
Everybody,
Nobody
I
does
think
it.
It's just that they're being shy
It's
by
a
raising
very
their hands.
healthy lot of people if you don't touch your phone the moment you open your eyes or within 10 minutes of waking up. That's the first thing, right? And second thing that I want to say is, even if you find 10 minutes, please exercise. And when I say exercise, I have talked about it on different platforms. Exercising does not mean you need to go to the gym and lift heavy weights. It could be any exercise. Simple body weight strength training combined with low or medium intensity cardio will do the trick. 10 minutes every day. If you're so busy that you can't exercise for 10 minutes, at least be active. 8,000 steps, 10,000 steps. Start slowly and build the pattern.
Right.
And finally, I'm going to say that...
2 foods.
Sorry?
2 food items, foods.
Food items. Well, I will say that take the holistic approach. Do not eliminate any macro. Don't go for diets which tell you no carbohydrates, no fats, no protein. It has to be a balanced approach. See, we have been eating food, balanced meals. If you look at any cuisine, you have a balanced approach. Just have balanced meals. And if you want to go for a fat diet or any specific diet, always seek professional help. And fourth one, please, yoga, meditation, reading books, listening to music, spending time with your family, friends. Basically, this is your therapy to de-stress yourself. Anything. So that, you are de-stressed and
you're happy.
Don't burn out.
Thank you. Dr. Lahiri, 5 food items that one must add in their everyday diet that will actually do wonders and magic to our body from within. Just 5 names.
Yeah. So before we even get to 5 foods or 5 types of foods that should be part of your diet, we should all definitely stick to the principle of consistency. No matter what you do, you're only going to get result of what you do consistently, whether it is a healthy thing or an unhealthy thing.
Correct.
What you repetitively do is what is going to show any sort of result.
Correct.
So there are some people who choose to eat very healthy over 5 days a week And then 2 days a week, they'll count them as luxury days or cheat days or whatever they name it. And then whatever effort they put over the 5 days goes out the window. So it's like they end up where they have started over the week. So avoid these kind of mistakes and stay consistent. Consistent doesn't mean you have to give up the luxuries, but be mindful of whatever the choices you are making so that you are conscious of it, and then automatically you will regulate the not so healthy decisions you are making with respect to food. Coming back to the 5 food groups, one should try to include in their regular diet. One, I would say, I don't like talking about nutrients, especially when it is general public, but rather foods. So as doctors and future doctors, I would also request that when you talk to your patients or anybody who asks you, doctors are held at very high regard, and most of the patients take your word for like God's word, and they will not consider or reconsider anything anybody else says. So please be mindful of saying what you say to them. Don't just tell them eat more protein, because a lot of times there is a lot of misinformation out there about what is protein and what foods are high in protein. Or just don't say, oh, stop eating all carbs or reduce the carbs. Give them a little more clearer instructions that they can follow. Coming back to the kind of foods, right? Getting back to food instead of nutrition. When we serve food on our plate, we don't see carbs, we don't see proteins, we don't see fats. Well, sometimes we do see fats, but with respect to proteins or carbs or vitamins and minerals, we don't see those separately served on our plate. What we see is we can identify grains. A child as young as, say, 1 year old can also differentiate between rice and dal, Identifying food groups starts very early. So give them information on what can be identified so that it can be incorporated on a regular basis. So make sure you have a certain amount of grains, a minimum of about 100 to 200 grams. This is all for general public, okay? 100 to 200 grams of grain-based products in your entire day at least. No matter how strictly you are on a diet you think, make sure you get 100 to 200 grams of grain-based products. It can be rice, it can be roti, it can be pasta, it can be whole grain-based noodles also. So choose grain-based products.
Next.
Choose at least a little bit of lentils and beans-based products. So it can be chana, rajma, any of those, or your regular dals that you use on, on a daily basis. Make sure you have at least one portion of that in any one of the meals. If you are not having any so far,
grains
or there are
and bean-based products you mentioned.
Beans, as in chana, rajma, chole, different kinds of legumes, really. So make sure you include these dals also. And at least dairy products or poultry, as in eggs, or if you are somebody who eats meat, include a little bit of that once or twice a week, if not every day. If you are somebody who consumes egg or who is open to consuming egg, include at least 1 egg every day, 1 whole egg every day, unless you have certain medical conditions that are going to prevent you from including 1 whole egg. Otherwise, fill your plate with colorful vegetables. At least 50% of what you eat in a day should come from vegetables in various forms. When I say various forms and vegetables, pakoda and samosa don't count. The fillings in those, or what's inside the pakoda, they don't count. What I mean by different forms is it can be minimally processed. It doesn't have to be completely unprocessed, but minimally. It can be salad, it can be soup, it can be a sabzi, it can be a gravy curry with vegetables in it. In any form you prefer or any form you feel it is acceptable, but 50% of your entire day's food in terms of volume should come from vegetables. Finally, definitely include fruits, but only about 1/3 of the quantity of your vegetables, roughly.
And of course, we say an apple a day keeps the doctor away.
Yeah. Any kind of fruit. And nuts and seeds. A fistful of nuts and seeds. This is like a personalized portion size. Okay? Whatever fits in your fist, and different kinds of mixed nuts and seeds. There is no one type of like almonds or walnuts or cashew nuts. There is no
it can
one
be a
kind of
blend
nut
of
or
seeds.
seed superior over the other. It's usually the medley of it or a combination of it, or taking those, different
mixture of it.
varieties over a period,
Right.
like over a week. As long as you get these on your plate on a regular basis,
That makes a
you're
balanced diet. Like,
good. Yes.
Yeah,
Well-
no matter what the fad diets you see online, social media, always remember it has to be sustainable, it has to be balanced, and it has to provide you nutrition. You should feel well, you should feel happy.
Absolutely.
Yeah.
Right. Well, thank you so much, doctors, and thank you so much, Urvashi, for giving us all the knowledge about the right food and the wrong food that we have been consuming. Thank you so much for being here. And I hope the audience now knows what exactly a balanced meal is, and probably they can start with their dinner today. Thank you so much.
Thank you.
Thank you. Thank you.
Conclave a lot more interesting. I would want everybody to please put your right hand up. Everybody. Thank you. And now I would want all of you to kindly place it on your heart. Everyone. So, you all can feel your heartbeat, right? More or less everybody can feel your heartbeat, except few gentlemen here who have worn heavy blazers. So yes, talking about heartbeat, my next fact check and a fun question for all of you is, can anybody here tell me how many times does a heart beat on an average in a human lifespan? I'm talking about the lifespan, so think bigger. Anybody? All medical students in the house, I would want to hear it from you. Sorry, I don't hear any answers. I just hear some murmuring. How many billion? Any guesses? Sorry? 2.5 to 3 billion. Where am I getting that from? I think right there. Okay. I get that right. It is 3 billion times. That's how many times on an average a heart beats, and I think that deserves a round of applause, guys. Heart is doing a fabulous job. Come on. Thank you. Thank you. All right. Let's move forward to our next session. The topic today stands rebalancing life, rebooting sleep and well-being. Indeed, a very important topic to discuss, as many of us now fail to keep up the basics, for which I would request the moderator, Diksha Navani, to please join us on the stage. Let's welcome her with a round of applause, everybody. Let's put our hands together. And now let's invite the speaker, Dr. Harshini Eravilli, founder, Sleep Therapeutics, Hyderabad. Can we give a big round of applause for her, please?
Check. Well, very good afternoon, everybody. This session is very important, I would say deeply personal, because I think this is something that we all have to really look into, which is rebalancing life by rebooting sleep and well-being. Well, before I start my session, I'd like to ask our students, the members in the audience, how many of you sleep less than 6 hours? 6 hours or less? Can I see your hands up? Show me your hands up. Come on, be honest with me, huh? Be very honest, okay? Let me also add myself in this. Okay, how many of you struggle to sleep? Oh my God, okay, we have a lot of hands here. All right, okay, and how many of you feel tired even after you get 7, 8 hours of sleep? Well, now you know why this topic is so personal and important. Okay, let me also ask you, if sleep was a subject in school, how many of you would be failing right now? Only you would be failing, nobody else. If sleep was a subject, how many of you would be failing? All the hands that went for less than 6 hours of sleep, struggling to sleep. Where are you guys? Okay, all right. How many of you use apps for sleep tracking? Nobody? Nobody uses any apps? Okay, we have 2, 3 hands here. All right. So a very warm welcome, Dr. Harshini, and I think we've just gotten our life statistics here. Let me start by asking you, what are the most common sleep disorders that you encounter today?
Thank you so much for the kind introduction, and thanks for inviting me as a speaker. Thank ABP for the platform. So I really appreciate, in the first place, I really appreciate the effort which has made my day, because ABP actually realized that basic lifestyle, diet, sleep, fitness, these are quite very important. So I really appreciate that. And for your question, I think most of the people already gave their answers.
Right.
So the most common sleep disorders is a loud snorer. The first one is snoring. So because snoring is a sign of obstructive sleep apnea, which causes many, many health issues. So snoring is the most common sleep disorder we see. The second thing is sleeplessness. So if you see 50% of them raise their hands saying they would fail the subject.
Right.
So sleeplessness, which is called insomnia.
Right.
People might take time to fall asleep, or people might take time to maintain their sleep. So sleeplessness is the second most common thing. And there are so many other things like sleepwalking, sleep talking, shouting and screaming in sleep. Some people, they just get up from their sleep and try to hit their partner, or otherwise hit themselves to the wall, so without their knowledge. So this is all called REM sleep behavior disorders.
Okay.
So we call this parasomnias.
Right.
So when more than half of the world is actually suffering from sleeplessness, there's other part to it where people do suffer with excessive sleepiness. So they sleep at night also, they sleep in the daytime also. So there's so many accidents.
So that is also unhealthy, right?
Right, of course. These latest, there's a study which came up which says that more than 9 hours of sleep is much more dangerous than lack of sleep.
Okay.
So even there are conditions like narcolepsy and idiopathic hypersomnia where patients do fall asleep for more number of hours. So these are all the sleep disorders which we keep seeing.
So Dr. Harshini, you've just mentioned so many different sleep disorders. Now tell me something, out of all of these, how many of you do you think are impacted due to the current lifestyle?
I would contribute almost 80%.
Okay.
So I'm sure that's a lot, but actually 80% of them. So just now a good talk by the dietitian and fitness coach has been done.
Right.
So obesity is a silent epidemic. So because of obesity, the snoring and sleep apnea increases. Because of stress, lifestyle issues, and also bad food, so watching screens. So all this is actually disrupting sleep, and that is causing sleeplessness. A lot of hormonal imbalances these days.
True.
Even that is causing sleep issues.
Yes. In fact, I think even PCOS, PCOD is one reason because of this, because of the sleeplessness issues and the hormonal changes that happen due to lack of sleep, right?
Correct. So actually it's like a cycle.
Okay.
So because there's no good food or good nutrition, because there's a lack of sleep and the lack of fitness. So this is causing hormonal imbalance. And because there is hormonal imbalance, again, the sleep is getting affected. So once you fall in this cycle, it's very hard to come out.
Right, okay. So you've just mentioned about this cycle and you said how hard it is to come out. But if you would had to advise something to do that, which all of us can follow, me included, because I also struggle, falling asleep at night. So how do we break that cycle? What are the lifestyle changes that we should, bring in to actually, get proper sleep and break this cycle?
So that's a very good question, and that's very important these days.
Yes.
Because there are so many people who don't follow good principles of sleep, and that we call as sleep hygiene.
Okay.
So there are few golden rules in sleep hygiene. One, it starts with the morning. So generally people think sleep is all about night, but it starts with the morning.
Okay.
So as soon as we wake up, we need to get 10 to 15 minutes of sunlight exposure. That too, anytime before 10 a.m. So because sunlight not just produces vitamin D, but it also produces melatonin. So this melatonin, once it increases its levels in the body by noon and by night, you feel drowsy because of that melatonin. So sunlight is very important. That's the first point. Second point is how much of a work you're doing. So you need to practice certain breathing exercises, like relaxing techniques, so that you don't get too much stressed up. And the next thing is your diet. Along with that, you need to have your dinner at least 1 to 2 hours before sleep. Because even your digestive system, it has to finish its work, at least half of its work, and then it can also relax. So finishing dinner 2 hours before sleep is quite important. And most important thing is avoiding screens 1 hour before sleep.
I was just about to ask that.
So because from screens there's a blue light which is being emitted, and
Right.
this blue light actually cuts down the melatonin, and someone who is watching screens all the time, they'll not be able to fall asleep.
True.
And the next thing is, before sleeping, you can practice again deep breathing exercise to avoid the thoughts which are being carried from the morning. So you might be in a busy, hectic schedule. For the next day, you might be planning only when the lights are off.
Correct.
But you need to relax when you're sleeping. So many people think that I'm too tired so I can get a good sleep. It's not like that.
True.
You need to relax before you sleep. And your environment in the bedroom should be very good. Whether it's light, sound, so all these things, a pleasant environment should be there while sleeping. So these are all the sleep hygiene rules which everyone should follow to
Right.
have a good sleep.
Totally agreed. So adding to what you just mentioned, you've talking about screen time. But even if we just skip the screen time before sleep, and if there's somebody who still cannot sleep because, they have some thoughts running in mind, or it can be due to stress, or, something like that. So do you have a message or a solution to it?
Correct. So we should never ignore disorders while following sleep hygiene.
Okay.
So if you're following sleep hygiene and if your lifestyle is good, so in spite of having a stressful lifestyle, you should get a good sleep.
Right.
If you're not getting that, that means something is wrong with your body. So a bad sleep, onset issues, or snoring, or waking up middle of the night, or even if you're getting 8 to 9 hours of sleep at night and still you're feeling tired in the daytime.
Lethargic.
Yes, lethargic and unable to concentrate, focus.
Right.
So when all these things are there, that's your quality of sleep is less.
I was just coming there next. You've just told us how the quality of sleep impacts on our physical health. But does that also impact on the mental health in short term as well as long term?
100% it impacts. So it's again a two-way thing. Mental health
Okay.
issues, they'll impact sleep, and
Right.
sleep also will impact mental health issues. Like, see, what happens in sleep is your body completely relaxes, restores, and rejuvenates. So when this is there, even your brain, mind, along with your soul, so everything takes rest.
Correct.
So when that is not of good duration or not of good quality, or any physical sleep health issues, mental health issues are there, then it's going to trigger them. So if there is a lack of sleep, the short-term consequences is immediately only your concentration levels, focus levels are affected. Your emotional hue will be seen. So anger spikes, crying spells, so these can be seen, and irritability. So a lot of people become irritable when they don't sleep well. So for the
Absolutely.
next few weeks, we can see some exaggeration of symptoms, which could be genetic also. Sometimes
Right.
some people can carry genes of mental health issues like
Correct.
schizophrenia and all.
True.
That can be exaggerated.
True.
On a longer period of time, it definitely affects on their mental health by creating depression, anxiety. And people consider it as anxiety disorder rather than sleep effect.
Understood. This is definitely a point to be noted, ladies and gentlemen, boys and girls, everybody here. Okay, so Dr. Harshini, now I'd like to ask you, what are the most common misconceptions on sleep that you've come across? So one example I'd like to highlight, that, if somebody is, say, sleeping for 4 to 5 hours a day, and then they can catch up on the sleep on weekends. We tend to hear that, and because we all have tight schedules and deadlines, we tend to do that a lot as well. So what are such misconceptions that you've come across? And please tell us about these myths.
Yeah, that's a great question, because every day I hear at least 5 to 6 myths from my patients.
Correct.
So the top one is this.
Right.
And people think I can sleep 3 hours, then I can get up, do my work, again sleep. And somehow people feel that exercise is also more important than sleep. So point number one is sleep is not a luxury. It is an essential.
Right.
So that is the most important point which everyone needs to understand. And the common myth is this: we don't need continuous sleep on a whole day of 24 hours. If we sleep for total of 7 hours or 8 hours, it's sufficient. It's not like that. Mandatory, we need 6 hours of continuous sleep. If a nap is included in the afternoon, it should only be 45 minutes and not more than that. So plus 1 or 2 hours is a subjective interest. So
Right.
somebody cannot, they cannot function with 6 hours of sleep. They might require 8 hours. So for an adult, it is 6 to 8 hours of continuous quality sleep along with a daytime nap of 45 minutes if it is required for them. This is one of the most common myth. And the second myth is, if I exercise late at night or late in the evening, then I get tired and I can fall asleep very well.
Exactly.
This
I
is
think most of
another-
us do that.
Yeah,
Yes.
this is the biggest myth. So if you are exercising in the evening, late evenings, after 7 p.m., because when I'm traveling back to my home after my work, then I see a lot of gyms being very active
Very
rather
active.
than in the morning.
Yes.
So that's not at all true, because your dopamine rush, adrenaline rush, so all your chemicals are in a rush so that you are getting into an active state after exercise. So exercise should be done ideally in the morning. If you like doing exercise in the evening or you don't have time in the morning, then you have to do it before 7 p.m. So 7 p.m. is the cutoff point for exercise.
Right.
And the third myth is people do consume alcohol to fall asleep.
True.
So although alcohol has some sedative effects, it does impact our adenosine metabolism, and that's actually going to impair your deep sleep. So somebody who is consuming alcohol for sleep, it's a big red signal. And the final myth is eat a biryani, have a drink late at night.
Or
and you'll
maybe
go
even
to sleep.
lassi, buttermilk for that matter.
Yeah, that matter, yes. Keep your stomach full and
Right.
get a good sleep. So that's another myth. So if your stomach is on a lighter note, then you're going to sleep well.
I think one more thing to this is also your sleep time, say from 10 to 6 is same as sleeping at 2 and waking up at 10, or sleeping at 4 and waking up at 12. That is also unhealthy, right?
Of course it is, but these days what's happening is, especially in metropolitan and cosmopolitan cities, there are a lot of companies which are there who work for other countries abroad.
Night
whose-
shifts.
Yeah,
Yes.
timings are really different.
Right.
So we call them night shift workers.
Correct.
For night shift workers, we can take it as an exception. But otherwise, on a general basis, when you're doing your day shifts, it's very much ideal to sleep by 10 or 11 at the max. So after that, plus 6 to 8 hours is the time you need to be in sleep.
Right.
Yeah.
So, Dr. Harshini, is there a relation between sleep and respiratory health? Are they related?
Yeah, completely related, because, see, I'm a pulmonologist.
Right.
So basically, I deal with respiratory issues. Then I
Correct.
did my fellowship in sleep medicine. So 70% of the sleep disorders, they are associated with your airway. So as I said, snoring. So for example, obstructive sleep apnea, which 70% of the sleep disorders contribute to obstructive sleep apnea. In that case, generally what happens is any patient who is suffering from asthma, sinusitis, so they have a blockage in their airway.
Correct.
Air is not able to pass through the windpipe, and there's no sufficient oxygen to the body. So brain is giving wake-up signals. Because of these arousals, your sleep is getting disturbed and you're having sleep maintenance issues. So this is called obstructive sleep apnea. And now in India or all across the world, 1 in 5 people are suffering from obstructive sleep apnea.
Does heavy breathing also come in that?
Yes, of course, heavy breathing. But the main symptoms would be snoring, daytime sleepiness, and of course, most of the people are obese.
Right. So coming to my next very important question, I think that everybody here would be interested in, how can technology be harnessed rather than hinder healthy sleep habits?
Great. Again, that's a great question. If I say avoid screens, is it possible? So that is
Absolutely not.
Primary
We
question.
cannot. True.
Yeah. So how do you use technology to sleep?
Correct.
And where should you put a comma or a full stop to the technology in the day?
Right.
So this is very important. So one thing is, I'll say the advantages first rather than disadvantages.
Yes, please.
So the advantages are sleep trackers. If you see, today we are seeing Apple Watch monitoring your sleep, Fitbit, Whoop Band, Oura Ring, Gabit. There's so many things in the form of rings, bands, and watches, which are actually measuring your sleep by quantity, quality, and all these things. So they are quite useful to screen your sleep. Second thing is, this will give you an idea about how much duration you're sleeping, what's the quality, and are there any arousals or wake-up signals. It will give a red flag signs also, so that you can go to your doctor. Next part is, see, in your phones also there's night mode. So
Correct.
blue light blockers. So these things will also help. Somebody is doing a night work, they cannot avoid screen 1 hour before. So at least they can switch on the night mode. You can use that. Third thing is, there are good number of apps to install cognitive behavior therapy, to measure your snoring levels, to understand, or even listen to some good music, peaceful music, to avoid white noise. So all these are the uses of technology. For that matter, in the diagnostics also, we use quite a lot of technology to detect any sleep disorders. So we do sleep studies, sleep test, polysomnography, and all this. And at the same time, even on a general scale also, if you see at home, there is home automation these days. In home automation, so you'll have a night scene where the curtains are off. Once it's sleep time, the curtains are
Correct.
closed,
Right.
and the lights are off or dim. So this is all the advantages of technology. And coming, like artificial intelligence is coming into place, so we can track the sleep disorders very well wherever they are. So they need not come to the doctor. The disadvantages would be mainly being obsession about the trackers. So people get into anxiety. It's just for you to understand whether you're sleeping or not. But you should not be anxious. What if I didn't sleep for 10 minutes? I am 10 minutes shortage of sleep, or should I go to a doctor? So this increases anxiety.
True.
Second thing is, people do watch screens a lot,
Correct.
scroll social media unnecessarily, and this unnecessary screen usage at night. So these are the disadvantages of technology.
So technology is good, but it should be used mindfully.
Of course.
That's how we can sum this up. And lastly, I'd like to ask you, what are some technological advances to help with these sleep disorders?
So definitely, again, sleep trackers are one good advancement,
Right.
which most of the people are already using.
Yes.
Second thing is, do not avoid your symptoms. So
Okay.
if there is snoring, if there is daytime sleepiness, if there is breathing difficulties during sleep, or if there is sleeplessness, it's taking more than 1 hour to fall asleep. So, or otherwise you're waking up in between and unable to continue sleep. So these are all signs and symptoms of sleep disorders. So there are few screening questionnaires which are available to help you detect if you're sleeping well or not. So please use them in a right way. And the next thing is, there is something called cognitive behavior therapy, which could be detected by the app. So even that can be used. So these are all technological advancements. And in diagnostics now, previously level 1 sleep studies, sleep labs, they were not very popular. But now, see, say we are doing sleep studies every day. So there are a lot of people who can approach and get the sleep studies done in the sleep lab or home sleep studies done. So there are exclusive centers for sleep medicine. So they utilize the services. And don't ignore sleep and don't think that I'll go after 1 year, I'll go after 6 months. When it becomes very severe, then I'll go. Because it's very difficult to treat a severe
yes,
case.
yes. And a lot of us actually tend to ignore it.
Correct.
We tend to ignore the whole sleep health pattern that you're talking about.
Correct.
So lastly, I think with this we can wrap up this session. Dr. Harshini, thank you so much. A quick advice lastly for everybody to rebalance life and improve their sleep health.
So only one line which I would like to say is, if you talk about productivity of your day, so you should be sleeping productively at night, because sleep is a part of your productivity, progress of health, and don't take sleep as a luxury, but it's an essential.
It is a necessity, yes. Thank you so much. A big hand for Dr. Harshini, everybody. This, I think, was a very alarming conversation, especially when we, tend to ignore our sleep cycle and sleep health in this tight schedule and heavy deadline era. So yes, thank you so much. We hope with your tips and tricks, we are all able to rebalance our life and improve our sleep health. Thanks again.
Thank you once
Over to the MC.
Thank you so much, Diksha. And once again, we thank Dr. Harshini for sharing her insights. And indeed, they are great. There are some great points to take away. And especially the last quote, it's not a luxury, it's a necessity. I think that is something which is going to stay with us. However, we've had a great session about sleep, I understand. But I hope you all are not going into it right now. We'll take a healthy pattern later on. Thank you so much. And I would now invite Vidya, Regional Sales Head South, to kindly step forward. Let's honor Dr. Harshini for joining us here today and sharing all her expertise here with us. Can we give Dr. Harshini a huge round of applause, please? All right, ladies and gentlemen, moving forward, stepping into our next session. This is going to be something very interesting, something you all would want to hear about. The topic for the session stands Global Dreams, Indian Dilemma, the medical journey abroad. I'm very sure the moment you all started, you all must have your own future plans, and I think this is something, the topic which is coming up, is definitely going to be a very constructive conversation which we're going to have here. So let's put our hands together as I invite the moderator for this topic. Please put your hands together for Vidhi Maheshwari. So Vidhi will be taking this conversation forward with our industry leaders here with us, the ones who help shaping the future of all the medical students who keep traveling abroad for a greater good. So now let's invite the speaker. Please put your hands together for Dr. Riaz, International Administrative Head, Tutelate Study, and Satish G, MD of SG Consultancy Services. Can we give both the gentlemen walking towards the stage an exceptionally huge round of applause as they take us through this topic?
So this is going to be a very interesting topic. We've got future doctors here who probably have had dreams of going and studying abroad, and they might have some questions that might get answered. And I have to apologize, I have a mildly sore throat, but lucky me, I'm surrounded by future doctors. So hopefully I'll get a few tips and remedies of how to fix my throat after this session. So thank you so much for joining us. So we've all seen a growing trend of Indian students pursuing medical education abroad. And I would like to ask the both of you, why is this increase happening? Is it because of the quality of education, infrastructure? Is it something that India is lacking? Or is it something that they gain out of getting an education abroad? Sir, I would like to start with you.
Yeah, first of all, I'm very much thankful to the ABP crew, and I'm very much pleased to be here today. And you rightly said, yes, there are many students going abroad for medical education, particularly the students who cannot get the seats here It is not that they are going abroad only because of the quality education. Of course, in India we have quality education, but the very unfortunate thing is we don't have sufficient seats available in India for the students. If you take an example, there are about 2.4 million students taking the exam, NEET exam, but very unfortunately only 1.2, 1.3 million students are qualifying. And among those also, there are only approximately 100,000 seats available in India. So that is the reason, with no other choice, the students are going abroad for their medical education.
I see. And you both have years of experience guiding students towards getting education abroad. What do you think is the reason, apart from education, is there any other, apart from seats, is there any other reason for students to choose abroad as an option?
Yes, Vidhi. I personally think that people in India, students don't get the exposure what they get outside India. They go through a lot of changes outside India, like cultural change. They have to take another language, for suppose, and they have to deal with another kind of patients, not in India. Like there are many kind of different cases outside India, which you can differentiate between. Like as Dr. Sir Satish has said right now, that India is lacking with seats. Let me tell you with the stats. Over 20 lakh students have been appearing in the NEET UG exam this year in 2025, out of which 12 lakhs have been like qualified, and 1,18,000 seats. They are fighting for 1,18,000 seats. 12 lakh students. The ratio is too high. So many students who are qualified enough, who can get the seats in India, because of, I think, the caste system also, which like from general categories, they have the same marks as the SC, STs, but they have like privileges and they stay back. So that's why people opt for going outside rather than staying back in India, and they get a good exposure over there too. Yeah.
So India is definitely losing out because these students moving out. What do you think are certain measures that Indian education system needs to implement to help these students get better education right here within the country?
Yes, of course. Better education with, as we discussed before, increasing number of seats. The only major reason students going abroad is a lack of seats in India. Like if you take example with other countries like China, Russia, other countries, they do have sufficient seats for their students. Complete, whoever want to do the medicine program in those countries, they do have sufficient seats. And apart from that, they are recruiting students from other countries like India, Pakistan, Sri Lanka, Gulf countries. They are recruiting students. So the main factor is scarcity of seats. India has to definitely focus on increasing the seats.
All right. And which countries do you think have seen the highest influx of Indian medical students right now?
Basically, for medical students, they need to have good infrastructure with good climatic conditions, and the language barrier should not be there, where the students can get good clinical exposure when they interact with the patients. These kind of situations only we get when the students go and study tropical climatic conditions countries. Let's say, for example, Philippines. If you go to Philippines, there you have even students from India, they don't feel like they are away from home. Because everybody speaks English there. Everybody, we can say more than 95% of the population, they speak English. And the climate is almost like Indian tropical climate. And food and accommodation also will be almost similar to India. So the students will be more comfortable and they'll have very good interaction, clinical exposure with the patients, which is really important for a student to become a good doctor.
Absolutely. So Philippines is one. Are there any other countries that are showing a high influx of Indian students?
Yes, of course. Many people opt to go to Russia. Russia is still under war, but people still go to Russia. Because Russia is too large. And the maximum number of students right now from India go to Russia because there are no private universities, there are only government universities in Russia. Okay, and people, like students, love to go to government universities more than private universities. So in Russia, there are a lot of medical universities which people often like to go. And I don't think like after Russia, there are many countries also in the Central Asian countries where people like to go as they get a different vast experience, you know, not like India. Yeah, India itself has the best infrastructure. Being a medical student myself, medical doctor myself, I've seen that like India, you cannot get anything outside. But yes, India should increase its seats for the sake of the doctors in future.
Now, I think there would be a challenge where these graduates come back to India and when they want to work here. So do you see there any challenges in integrating them within the Indian healthcare system now that they've studied abroad, practiced abroad, and now they've come back? What do you think are the challenges?
The main challenge for the Indian students who go outside is the clinical part, you know. They're good at the theory part. The IMGs, we call them INGs, Indian medical graduates, they have the best clinical experience whatsoever in the world. India is top in the line, you know. And people who are going to different countries, obviously they'll not get that better experience like in India, but they'll have a good exposure when they come back to India. They'll have the theory. They can come back to India. They can write their MCI, FMG exam. Now coming to the next one, and they can clear that, and they can join with the Indian medical graduates and work seamlessly.
I'd like to ask both of you now. India is already facing a shortage of healthcare professionals. Of course, increasing seats is one solution, but there have to be other measures as well when it comes to medical infrastructure, when it comes to changing the curriculum a certain way, or providing the kind of experience that the students need. What do you think needs to be implemented right away? And there's students here who can be benefited from certain changes that the Indian education system needs to do. So what do you think those suggestions would be?
Yeah. Before this NMC took over from MCI, MCA has a list of medical universities in abroad where the students has to go and study. Like though they have certain number of seats in India, even in abroad, our MCA has nominated some recognized some medical universities in abroad where the students can go and study. It is not like they can go and study wherever they want, however they want. They have made some system and they have recognized some universities. Later on, that list has been removed. Now again, NMC is also working on that. Most probably by next year, next academic year, hopefully we are thinking that NMC will also recognize some universities worldwide, wherever the country, whichever the university, they will recognize depending on the standard, and also maybe they may come up with the capping system. So this university, this country, this many seats. So they might come up, they are doing some homework on that. So hopefully from next year onwards, NMC also will identify and recognize and list out some colleges in abroad where our students can go and study. So there won't be any discrimination also. Why? Because in the coming future, Indian students also has to take the next exam. Those students graduating from abroad also has to take that next exam. As of now, that exam is not there for Indian students. Only if foreign medical graduates are taking that exam. So in coming future, that will be equal for both the students studying in abroad or India.
And that will definitely benefit the students.
Yeah, that will be benefit. Wherever you study, that doesn't make any difference.
Yeah.
Only thing is, you should be qualified by the next exam.
Any inputs from you, Dr. Riaz?
Of course, as Sir has kept the light on these things, like there are exams which are taking replacement, like the FMG is replacing, the next one is replacing the FMG exam, the screening test, which is also known as MCI, Medical Council of Indian FMG, like Foreign Medical Graduate Examination. A student who is studying in abroad has to come back to India and appear for this exam. This is like Yearly, they have 2 attempts for these exam. And after that, they have to go through a mandatory 1 year of rotatory internship. With the government of the India, they have stipends also. And yes, coming to the next, when it will be implied, both the foreign medical graduates and Indian students have to go through, it will be a common exit exam for the medical graduates, even from foreign and in India. Like, they don't have any difference in that. Right now, only the foreign medical graduates give the FMG exam, not the Indian students. But in coming future, this is going on right now. It's a controversial thing to talk about. But yeah, it will soon be implied, and better for like India and the abroad students also. And I'll say financially also, it is very big difference in India and abroad, you know. Private colleges here, everyone knows here in this hall who's present that how much is the charges. And you know, 1/4 of the charge, you can do your 6 years job like MBBS outside India.
1/4 of the charge.
Yeah, 1/4 of that charge. You know how much the private colleges in India, the charges, 1/4 of that you can do it like for first 6 years. That 1/4 of charge is enough for you for foreign medical education, like countries like Russia, Kyrgyzstan, Uzbekistan. There are plenty of countries, Philippines, of course. Yeah.
So a lot of students and families also believe that probably opt to study abroad is that you can get better opportunities. Be it job-wise or be it looking for a partner. So do you think there's a huge difference in the kind of opportunities that Indian education provides vis-a-vis when you come back studying abroad? Is there a huge difference, Mr. Satish?
Yes, of course. When the students come back to India, there are students have seen, they have attempted twice, thrice their NEET exam to get a seat in India, but unfortunately they have wasted their 2-3 years of time, and unfortunately they could not get the seat in India, and they came abroad, they completed their course. Again, when they came back to India, we have seen hundreds of students who cracked their PG entrance exam in the very first attempt, that too free of cost in A category. I mean to say A category, government universities in the specialization what they want. So it is not that there are quality students could not get the seat. There are many students in India who could not get the seat. That is the reason they are going abroad. With the quality of education what they get in abroad, they are coming back and able to crack the PG seat also.
So the quality of education also needs to change.
Yes, of course. Like, I know many students who come back to India. There are brilliant minds out there who don't get opportunities in India after writing the NEET UG exam, and they opt to go outside India. God forbid they don't plan to stay there. You know, I have seen students who come back to India and crack the NEET PG exam and get their seats in the AIMS, the top most privileged universities, one of the most top universities in India. So students are very optimistic. They want to do this thing, and many students, after 2019, everyone knows that COVID-19 has affected the healthcare of India, the infrastructure of India very, very strongly. And after that, the medical sector have been getting a significant boom. That's why I think we are sitting here right now. And yeah, India should increase their seats for more opportunities for Indian students who are willing to do, who have the wings, who wants to fly, who wants to become a doctor, who wants to serve the humanity, I think. Yeah, they have to get a chance, a fair chance.
Lastly, I would like to ask the both of you, we've got future doctors here. What advice would you want to give to the students here who want to study here or probably opt to go abroad? What should be the right reasons? And also a few inputs on what should be the initial changes that the education system needs to implement.
basically the student who want to do medical program, they should do with their interest, and that passion should be there for the student, wherever it may be, whether in India or abroad. The student should opt the medical course, particularly who want to go abroad, they should be serious towards their studies. Only the students who are serious towards their studies has to select this medical program. Particularly the students going abroad should select a decent universities where they have very good clinical exposure. All these will get where the population is very high, like China, Ukraine, Russia, Philippines. These four are the pillars for abroad medical education. But for some reasons, Ukraine and China are no more for abroad medical education. Nowadays, students are going to Russia and Philippines, which are the best destinations for the students to do their medical course. So I recommend all the students to study their medical course in abroad, particularly Russia, Philippines, or any other countries where the population is very good and students can get good clinical exposure.
Good
Yeah, that's
exposure,
important.
yeah. What would your advice be to the students here?
The advice from my side, the students, the upcoming doctors in India would be work hard. Please work hard. Obviously, being a doctor is not joke. It's not a joke. MBBS, it's not a joke. You're handling a life, you know. So you have to be more precise, you have to give time to that. You have to be there when you're needed. So we just stay focused, and the students who wants to go out of India, they can like choose good countries with good infrastructure, with people like sir who have like good experience, and they can pursue their MBBS goals, which cannot be pursued in India right now. Yeah. So from my side, the advice will be please work hard, and India needs you.
Absolutely. On that note, thank you so much, Mr. Satish
Thank
ji
you.
and Dr. Riaz, for this insightful
Thank you, Vidhi. Thank
conversation.
you.
I hope students here paid a little bit of attention and got some insights as well. Thank you so much. Thank you so much.
Thank you, Vidhi.
Rightly summarized, India needs you. I think that is something to take away. Thank you so much, Vidhi, for moderating the session. And we thank Dr. Riaz and Mr. Satish for joining us here. I would request Mr. Nageshwara Rao, editor ABP Desam, to kindly step forward as we honor our speakers here with us today. Can we give both of them a huge round of applause, ladies and gentlemen, for all the incredible insights they've shared today, something to take away and keep in your mind before you plan your next abroad. Step forward to our next session. This is definitely something which is the need of the hour, to be aware and to know more. The topic for this session stands Fertility Struggles to Fragile First Cries, India's Urban Crisis. Let's take a look and let's dwell deep into this topic. I would request our moderator, Chahat Jain, to please join us on the stage. Let's welcome her with a round of applause, everybody. And we now invite our speaker, Dr. Suresh Kumar Panuganti, Pediatrics, Yashoda Hospital, Hyderabad, and Dr. Sarada M, Gynecologist, Laparoscopic and Robotic Surgeon, Yashoda Hospitals, Hyderabad. So we have our leading doctors today from Yashoda Hospital joining us, who will be taking this topic forward with our moderator, Chahat. Let's dwell into the session and let's give them a round of applause, please.
Welcome, doctors. But before I start the session, can I please request everybody who's standing at the back to take their coffee and their tea and come and sit over here? Can I please request all of you? So before I start my session, also I would like to share some alarming facts that a lot of us might not be knowing, but it is actually alarming. And it's not alarming just for us as individuals, but also for our country. So in the year 2025, which means the present year, the total fertility rate, which is also called as the TFR, it has declined to 1.9 children per woman, which was earlier 2.1. So that's a huge decline. When we talk about infertility, about 15 to 20% of young couples are struggling to conceive. IVF is rising thanks to the medical education.
Okay.
But again, most of the IVF patients are below the age of 35, and that's actually alarming. So I would like to start with you, Dr. Sharda. What is the young generation? What is the one thing that the young generation is probably doing wrong that is actually contributing to such alarming numbers? Or is it not something that people are doing deliberately, or something that is maybe things are changed around us, maybe what we are eating, or pollution? What is actually contributing to this alarming number?
Yes, Chahad, that's definitely a very good question, and we do come across a lot of people coming to our OPD asking these questions. The parents are they're very happy that children have achieved a very great level in their careers. They're doing good, much good, trying out their dreams. But the family part, they're not able to plan a family because definitely things have changed. A lot of urbanization. Our career priorities are different. We want to settle, then plan a baby. Initially, it was not like that. You get married, study with your age. Age is what they used to consider. You should get married
Age is
by
the factor
this age.
you mean to say.
But now, delayed marriages, late marriages, and even after marriage, people want to wait. Nowadays, with a lot of social media coming up with egg freezing. So options are more for women to have their eggs with them. So things are changing.
Okay. Doctor, coming to you. It's not just, it's not a women's problem. It's not just couples' problem. We have seen that. I just wanted to ask that, is there any correlation between infertility and the kind of rare diseases we are seeing, the surge of rare diseases in newborn babies? Is there any correlation between the two?
Yeah, absolutely. Nutrition, when we are talking about a pregnant woman, the nutrition begins from the childhood itself. The feed the child, the newborn baby or an infant, or when the weaning was started, what kind of foods were introduced. And thanks to social media, now we are seeing a lot of obesity. Previously, we used to see malnutrition, that is MAL, that is undernutrition. Now we are seeing on the other end, malnutrition, MALL, because of all these ultra-processed foods and all. So we talk about junks. It's not the junk food what you're talking about, JUNCS. That is junk food, ultra-processed food, nutritionally inappropriate food, carbonated or caffeinated drinks, sugar and sweetened drinks. All of these lead to an unhealthy lifestyle, obesity, and then some of these are associated with endocrine disorders as well, and subsequently they end up getting married late, and then they end up going into these IVF and other things like that.
Dr. Sharda, you mentioned that there are pretty good lifestyle issues that especially women are facing these days.
Yes.
So do you think, can you name some, because I know that people are indulged in activities they are not meant to be, and there is no proper awareness, especially at the school level, at early ages, that that you should not be doing this, you should not be eating that. So do you think that these lifestyle changes are actually contributing much to this rate?
Definitely, Chahat. See, our society has changed. We want our kids to study well. So usually that adolescence starts, girl is in her 12th class, 12 years, and then it goes on till 18 years. That's the time when they are in their 9th, 10th grades, plus 11th, 12th, intergrades. So there's a lot of pressure on them that they have to get into some good colleges, IITs, NEET exams. So many things. So they are studying. I'm surprised. Kids come and tell me they study till night 11, 12. 8th class kid. I hardly remember studying in 8th class. So things are changing. They are made to study from morning 6 till night 11, 12. Hardly time to sleep.
so many workshops, so many exams. So there, that lifestyle is changed from the adolescent age. So
Apart from the practices, they
Yes.
should not be indulging in.
Yes, so they're not playing.
Harmful things maybe.
They're not playing at all. No play. They're just sitting and studying, which is very alarming.
So basically, you mean to say that it all starts at very early age?
Yes.
Doctor, coming back to you, earlier you mentioned that, we used to hear about the term malnutrition, but it has completely gone and we are now talking about obesity. We also hear a lot of kids having sugar and diabetes at very early age. Isn't it very alarming, like somebody is just 5 or 6 and they have diabetes already?
Absolutely. Earlier, we used to talk that South India is the hub of diabetes for adults.
Right.
Now, overall, India has become hub for type 1 diabetes. That
That's
is
true.
diabetes in childhood. We see children as young as 1 year.
One
I'm not
year.
talking about genetics. If you're talking about congenital or neonatal diabetes, yes, we do see in neonatal period. But I have nearly 120 children who are type 1 diabetics under my regular follow-up. And the youngest one was 11 months.
Oh my God.
Surprisingly, both parents do not have diabetes. You
So
cannot
what
blame
could have
genes
been the
for
reason?
everything. We had our earlier colleague from Map My Genome. They could prove that it is not genetic. So yet, there are a lot of children who are coming with diabetes. What we need to realize is it is going to change the lifestyle of entire family because it is
Yes,
not
right.
disease of the child alone. Child needs to take insulin for lifelong.
And the other generations would be following.
It includes financial, emotional, all sorts of aspects when a child is diagnosed with diabetes.
Doctor, he just mentioned the word financial. When we talk about infertility, it also comes at a huge cost.
Yes.
So, medical sciences have improved, it has developed. But do you think that since the numbers are alarming, we also say that around more than 24.7 million couples in India are struggling to conceive. So it's a huge number.
Yes.
These people might be sitting in tier 2, tier 3 villages, urban cities, anywhere.
Yes.
So do you think it is our responsibility, the medical authorities' responsibility, to make it more accessible and affordable?
Definitely. So we have a lot of government hospitals and government is thinking. So we have some IVF facilities in the government hospitals. So there are some deemed hospitals like AIMS, NIMS. So NIMS doesn't have an IVF center, but AIMS definitely is looking at it. And a lot of medical colleges, especially in Telangana, government medical colleges, they are trying to establish an IVF unit along with the gynecology unit in the college. So that could help out many women who are financially, they cannot afford.
And also, how about spreading awareness and breaking the taboo?
Yes.
Because still a lot of people are, shy to discuss their issues. Forget doctors, they can't even discuss the issues amongst their peers. So we need to also promote this health literacy amongst people as well.
Yes, definitely. The social media is playing a lot of role, good role. Lot of things are there now on the media, YouTube, on the news channels and all. So they are like half aware. They're not totally aware. Lot of myths are there. So maybe more information leaflets to them, small bites about their sexual health or when they should plan their pregnancies would definitely help out.
Yeah. Also, we also say that, half information is more dangerous
Yes.
than having no information. Doctor, coming back to you, we spoke about diabetes. But, if you see a lot of newborn or a lot of children are also being born with rare diseases. It used to be like really rare a decade from now. But now children with special needs, the number of children with special needs is increasing. Children with rare diseases is increasing. Again, do you think it's a lifestyle issue that maybe a bad lifestyle parents must be following that is actually genetically being transferred to the baby?
I would rephrase this and answer in two parts.
Sure.
One, probably it's not that rare. The reason why I'm saying it's not rare is we are diagnosing them more now. Some of these diseases have been existent for long time, but we didn't have facilities to make a diagnosis.
Okay.
Thanks to the COVID, I would always thank to COVID for a lot of reasons, because it has raised awareness among the general public that there are some genetic tests. There
Right.
is something called PCR, and people are ready to spend on that to know the diagnosis. And coming to children with special needs, yes, Just a story, during COVID, we had a child who came to us, was talking, none of us were able to understand what he was talking, including the parents. It took 3 visits for us to understand he was speaking Korean.
What?
Both the parents are not from Korea, and lot of these younger generation will realize thanks to K-pop and Korean serials. Okay, child was religiously following this. He picked up that language before the mother tongue. Okay, and he was not able to communicate with parents because both parents didn't know Korean, and he was not responding to name calling. This is what we call screen time induced autism. Autism, ADHD, the awareness amongst doctors has increased and we are making a diagnosis. And now there are a lot of developmental pediatricians who have come up and we are able to provide therapy. These diseases were there, but definitely it's increasing, alarmingly increasing, I would say.
Doctor, similar kind of question to you. I mean, rare diseases, rare fertility issues. People usually don't know about their bodies, properly. And again, all of a sudden, they get to know that something is wrong. So, do you think that proper awareness, proper education, medical education should be given at very early stage? Yes. What should be our steps to make people aware?
So there are a lot of medical conditions like SLE, diabetes, women who have kidney problems. So eventually they'll have transplants, renal transplant at a young age. So even they are becoming pregnant now. So girl who had a transplant at a younger age, so they'll be on some medicines. So they are attached with some doctors for their medical condition. So it is there they should get an education that when they become pregnant, what they have to do. Can they become pregnant or not? Will pregnancy affect their medical condition? Can they survive? A lot of heart conditions are there which are not good. So the primary doctor who is taking care of them should be educating them.
Doctor, also, there's a combination of vitamins, minerals that everyone, this is for both the genders, everyone should be taking from an early age. This is not just for the fertility or for the newborn issues. This is for a well-being, like the entire well-being as well. So do you think that we don't even tell our children, tell our daughters or tell our sons that, this is a combination that you should be taking? Vitamin D, B12, vitamin C, these are actually the most common deficiencies that India is actually suffering through. And if we start taking, if not supplements, but maybe in the original form, from the young age, then we might eradicate such issues.
So we have to practice first. Maybe we should practice all those good lifestyle changes to tell them very good. And it's definitely at young age. Maybe the school teachers or when they have. So like you have said, the vitamin D, which they have to get exposed to, get good vitamin D in them, good B12.
We do see a lot of vitamin deficiencies and they present very late. Inability to walk, inability to see, which could have been easily prevented by eating dark green leafy vegetables or going in the sun, which most of us we did as children. But now various factors do play in that. I do not blame one particular sector, be it school or be it parents, nuclear families, be it impact of media. All of those things have led to children being deficient. Now we have to take the first step. As medical personnel, it is our responsibility to educate amongst the school children because everything begins from there.
Right.
And when a teacher says, they tend to believe it more than when father or mother says.
Right.
Okay? And when you guys in media say, it can go to a larger population in a shorter time. So I'm very glad you guys have taken such initiative, bringing on so many different fields in medicine to public. And I'm sure you're going to publish a lot of this in the news, which will educate much more than what population we are seeing here.
Doctor, I would like to ask you the one final question. How many parents are coming to you and talking about the mental issues or the mental conditions their children are going through? Because, mental health is also an alarming thing that is becoming very common in very young children. Like, you would see anxiety issues or, pre-depressional issues in young children as young as 7, 8 or 10.
It is definitely alarming. I would quote Deepika Padukone to say, it is normal to be not normal.
Right.
Okay, and don't hesitate to come out and speak to your parents or teachers or doctors or your friends when you are not feeling okay. Don't think that people will judge. Gone are the days. Now, so many celebrities have come out saying in open that yes, they have gone through depression or mental health issues. Now, we are seeing a lot of children coming up, opening up. We have adolescent clinics where a lot of adolescents come and talk. One thing we have to make sure that they feel safe to open up. They feel safe to feel that we are non-judgmental. That is when they come up.
Doctor, same question for you, especially
Yes.
for women,
Yes.
especially for such couples
Yes.
whom we are talking about, whom we have shared these numbers. Again, opening up, do you think they are still hesitating? That is actually delaying their treatments, and how is it contributing?
Lot of hesitation is there, especially they don't want, even with the partners, when the wife doesn't want to tell the husband doesn't want to tell. Every level the hesitation is there. So that comes through lot of awareness.
So as a doctor, what would you like to tell them?
Maybe
a message from your side.
Yeah, so speak up, speak. Whatever you feel, maybe you can speak first. Let the other person understand, is it right or wrong? The doctor or somebody who knows what's happening should know.
And only then you people would be able to help.
Yeah, in fact, we have a program which we do for young doctors in our hospital because
Great.
we have a lot of postgraduates studying in. Every year we do a program asking them to open up. We form small groups, let them open up because even doctors, as doctors, sometimes we go through stress, we go through
Right,
depression.
correct.
So if we are okay, then we can make sure others are
Correct.
okay.
Well, thank you so much, doctors,
Thank
for
you.
speaking up, for opening up. And I hope that now people know that it's okay to talk, okay to open up. And again, if you have any queries, if you have any questions, doctor are still with us, and you can probably take this up later. Thank you so much, doctors, for
Thank
being
you.
here.
Thank you, Chahat.
Thank you so much, Chahat, for coming up with some spectacular questions on the given topic. And I would like to thank Dr. Suresh Kumar and Dr. Sarada for sharing their views. Requesting Mr. Sunil Goswami, Editor, Digital Videos, ABP Network, to kindly step forward to the stage and felicitate the speakers here with us. Requesting Mr. Sunil Goswami to kindly join us. Let's give him a huge round of applause. So moving on to our next session, the topic stands from screening to care to creating an inclusive renal network. Let's invite the moderator for this topic, Vidhi Maheshwari, to the stage, and let's give it up for the speaker joining us. Put your hands together for Mr. Subodh Gupta, Director of Friendlix Health Systems Private Limited. Let's welcome sir with a huge round of applause, please. Thank you so much, sir, for joining us. Over to you, Vidhi. Let's take this forward.
Thank you so much, Mr. Subodh Gupta, for joining us. Now, Renalix is on a mission to make dialysis treatment more affordable, more accessible for the country. So let's talk about that. How are you doing, by the way? Thank you for being very patient.
Thank you, Vidhi. And first of all, let me thank you and the ABP network for inviting us here and, discussing about creating a network which provides a continuous support to patients suffering from the CKD.
Yeah, so chronic kidney disease is a major concern in India.
Right.
And the affordability or accessibility to care is very limited. Why is that?
What I understand, the major reason for it is, the distance of the dialysis center to the patient's home and the access to dialysis for these kind of patients. You'd be surprised to know there are around 20 million patients in India who require dialysis. And with our current infrastructure, we are able to provide regular dialysis to only 25 lakh patients.
Oh.
So that means there is a huge need huge gap. And if we talk in terms of number of machines, so currently in India, we have around 54,000 operating dialysis machines, all companies put together, while the need is around 2.5 lakh dialysis machines, given the number of patients we have. So that's the gap which we have today. One of the reasons for this, which I understand, is our dependence on imported, machines.
Machinery.
So today is primarily some foreign companies which are primarily supplying the dialysis machines to the country. So that could be a reason for this gap.
So Renalix has identified this gap. And how are you working on closing this gap? The mission that you have, the Made in India machine that you're working on. Let's talk about that.
Right. Thank you, Vidhi. So we are the, we are the company as Renalix. We have developed the first indigenous machine. When I say indigenous, it is not a, it's not a knockdown model or an assembled model. This machine has been developed in India by our scientists from scratch. So you can proudly call it's the first Indian dialysis machine.
All right. And how do you plan to make it accessible to the population that you've mentioned, who's losing out on the proper care?
Right. So it's very important that this benefit reaches out to the patient who require this. And that's where we are working with a lot of state governments, the central government, the NGOs. And our mission is to bring dialysis closer to the patient. See, a lot of patients do, drop out of the dialysis in the first year itself. The reason being the travel time which is required to reach a dialysis center. Today, there are a lot of governments who are supporting in terms of giving a free dialysis session to the patient. But unfortunately, because of this logistic issue, there are still a lot of dropout seen. So we want to bring dialysis closer to the patient.
And what percentage of the machine components are sourced locally? Like you said, this is absolutely made in India.
It's more than 80%. It's more than 80%. And the rest of the 20%, which are critical components like some pumps, we are also working on it. And by the end of this year, we'll be able to do 100% indigenization of the machine.
So I was reading that dialysis in India is far cheaper than what it is globally.
Right.
But it is still, affordability is still an issue in our country.
Right.
So apart from accessibility, how are you going to help make this care more affordable?
So if you look at, the number terms, one dialysis procedure in India is close to $80 as compared to $250 to $300 globally. And most of this, for the patients who fall under the BPL category, is taken care by the government. Yes, either it is under PMNDP or various state health programs like the Arogyashri here. However, since, there are a lot of patients who do not fall into this category and they have to be out of pocket and they have to take 3 sessions in a week, which is 12 sessions in a month, which is quite a, a huge financial burden on a middle class or a lower middle class population. So what we are trying to do is we are trying to work with NGOs, we are trying to work with various government authorities. We are trying to place, our machines where we can cut down the cost of dialysis. Another part which I discussed about was the logistical part where the patient has to spend the entire day and money to travel to the dialysis center. So if I bring it closer to his home, then probably that cost also we can come down.
What you're working on, what your plans are absolutely fantastic, and they'll help so many Indians who are suffering from chronic kidney diseases.
Thank you.
Are there also plans of working with insurance companies to help make this a little more affordable? Because the issue is accessibility and affordability both.
Right. So, we are working with insurance companies. We are, working with them in order to make them understand that, dialysis is a requirement without which a patient of CKD who is into stage 5 CKD, stage 5 CKD cannot survive. So we need their support. Insurance companies have been supporting, and we are working with them to bring the cost down in terms of, bringing the premiums down to help them understand that this is a need which is, a very basic need of a person who is suffering from CKD.
And despite such huge numbers, we've got 20 million people suffering from chronic kidney diseases. There was never a made in India machine before.
Right.
So why was there a challenge, and what were the challenges that you faced when you came up with India's first Indian country-made machine?
Right. So surprisingly, you'll be surprised that we as a country have advanced a lot in other technologies, like it may be a software or an AI or even defense technologies. But somehow as a country, we were lacking in the medtech area. So we realized this, our founders realized this, and we started working on these projects around 11 years back. It's a complex machine because you have to take the blood out of the patient's body, purify the blood, and put it back into the patient's body. So it's a complex machine. The technology was not so easy. But we have been able to do it, and you will be glad to know that our machine has been certified by the European authority. So it is a CE certified machine. So it is as good as any other machine globally available.
That's great. And it is now available in India?
Yes, it is available. We have got the production license. So in next couple of months, we are going into production, and it will be commercially available in India.
Oh, that's wonderful. Hopefully a lot of Indians will be helped with this. I would also want to know, what message would you share with healthcare professionals, especially patients, stakeholders? Because when you implemented and you created this machine, there were challenges that you faced. There were learnings that the company and your founders had. So what is the message that you'd like to convey?
So we as an organization not only work on dialysis as a process, we also help in a primary screening of CKD patients. CKD is one disease which progresses very quickly. So we want the screening to happen at a grassroots level, for which we have an app where with a very simple test, a patient can be identified whether he is a CKD patient. So if we know that at a very early stage the patient is suffering from CKD, then early intervention can delay the progression of disease. Number two, we are working with healthcare professionals, and my request to all the healthcare professionals, the nephrologists who request for their support for this machine. This is a global product. It's a world-class product. And you'd be surprised to know, Vidhi, that we have got thousands of inquiries from countries outside India, and those companies and those service providers are very, very interested in this machine because it has got some very unique features. It's a world's first smart AI dialysis machine, where the monitoring can be done remotely. Today we have around 3,300 nephrologists in our country, but they are mostly based in metro cities. And, it's very difficult for them to monitor a dialysis which is happening in a remote town. But with Renelix system, they can monitor the dialysis on a real-time basis, sitting anywhere in the world. If there is an issue, they can do an intervention right from there, help the dialysis technician. So there are a lot of very innovative features which come along with the Renelix system, which are not available with any machine globally as on today.
Like you said, you started on this project 11 years ago, and there's clearly a lot of hard work, a lot of learnings that have gone in. And I think you'll be able to help a lot of Indians. You'll be able to help a lot of people, actually, not just in India and globally. Is there a message that you'd like to give? We've spoken about the stakeholders and medical professionals, to the people as well, because renal care, like you said, screening is something that people probably miss out on. A message on taking care of their own renal health.
Right. So, although I'm not a doctor, but we all know that CKD happens primarily because of uncontrolled hypertension and uncontrolled diabetes. That is where the kidneys get impacted. And there is a huge population in our country who suffers from both these diseases. So the best is to improve your lifestyle, work on a healthy lifestyle, and if at all you get a hypertension or a diabetes, ensure that it is under control. So if it goes uncontrolled, then it leads into a chronic kidney disease or a ESRD.
Perfect. Thank you so much for talking to us, Mr. Subodh. We've learned a lot about the machine. I wish you all the luck, and I hope more and more Indians have access to this. Thank you so much for making this renal care, chronic kidney disease to be much more affordable, much more accessible. Thank you so much for your time.
Thank you, Vidhi, for giving us this platform to talk about.
Thank you.
Thank you so much.
Thank you so much, Vidhi, and thank you so much, sir. I would request Mr. Nageshwar Rao to please join us on the stage as we felicitate sir today here with us. Thank you once again, Mr. Subodh, for your insights. Mr. Nageshwar Rao, please stay back. So, ladies and gentlemen, the next topic, the next session for today is healing beyond pills, the rising relevance of naturopathy in pain management. The moderator, Mr. Nagesh, is here with us. And let's put our hands together for the speakers for this topic, Dr. B. Mastan Yadav, naturopathy and pain management specialist, founder of Healing Hasta, and Dr. Ramakrishna Vishwanatha, Ayurveda Vachaspati. Can we give both of them a big round of applause as they're joining us here today on the stage to take forward the next topic, healing beyond pills, which is very much required in today's era. Sir is here with us, joining us. Can we welcome our speakers with a louder round of applause, please? Thank you so much. Handing it over to the moderator, Mr. Nagesh.
So welcome Dr. Mastan Yadav, he is the pain management specialist, and Dr. Ramakrishna Garu, Ayurveda Vachaspati, and experienced hand in Ayurveda. Sir, coming to first Ramakrishna Garu. So modern medicine enta develop అయినదో మనం చూసాం, బట్ మనకి అంటే ఎక్కువ మంది మన బిలీఫ్ సిస్టంలో ఉంది ఆయుర్వేద కూడా కొన్ని జనరేషన్స్గా ఫాలో అవుతున్నటువంటి సిస్టమ్స్ కానీ ఇవన్నీ కూడా. మోడర్న్ మెడిసిన్ చాలా వరకు కూడా లేటెస్ట్ డిసీజెస్, క్రానిక్ డిసీజెస్ వీటన్నిటికీ కూడా సొల్యూషన్ క్లియర్గా విత్ ప్రూఫ్ ఇస్తుంది. సో యాన్షియంట్ నాలెడ్జ్, వై వీఆర్ కాలింగ్ యాన్షియంట్ నాలెడ్జ్ అనేది ఎంతవరకు వీటికి సొల్యూషన్ ఇవ్వగలుగుతుంది? ఆన్ లాంగ్ ప్రెస్.
హలో. సో మీరు ఇప్పుడు చెప్పారు క్రానిక్ డిసీజెస్ అని. సో క్రానిక్ డిసీజ్ అనేది ఒక రోజు వచ్చేవి కాదు, ఇవన్నీ కూడా లైఫ్ స్టైల్ డిసీజెస్. సో ఆయుర్వేద ఆల్వేస్ బిలీవ్డ్ ఇన్ న్యాచురల్ సిస్టమ్, అండ్ నేచర్తో ఎంత సింక్ అయి ఉంటే అంత మీరు డిసీజ్ నుంచి దూరంగా ఉంటారు. సో ఇప్పటి వరకు చెప్పిన ఇంతమంది ఎవరైతే మాట్లాడారో ఆహారం, సో ఆయుర్వేద స్ట్రాంగ్లీ బిలీవ్స్ ఇన్ 3 things. వన్ ఈజ్ ఆ త్రయ ఉపస్తంభ అంటారు. దే ఆర్ లైక్ 3-legged stool, 3 ఉంటాయి కదా కాళ్ళు. సో ఈవెన్ వన్ వర్టికల్ లెగ్ ఈజ్ వీక్, ద స్టూల్, ద బ్యాలెన్స్ ఆఫ్ ద హ్యూమన్ బాడీ విల్ బీ గాన్. సో అందుకనే ఆహారం, నిద్ర, బ్రహ్మచర్యం 3. సో ఫుడ్ ఇంటేక్, దెన్ గుడ్ స్లీప్, దెన్ బ్రహ్మచర్యం అంటే లైఫ్ స్టైల్, గుడ్ లైఫ్ స్టైల్, మెంటల్ యాజ్ వెల్ as ఫిజికల్. ఇవైతే ఎప్పుడైతే పాటిస్తారో ఆటోమేటిక్గా మీ క్రానిక్ డిసీజ్ నుంచి దూరంగానే ఉంటారు. సో ఆయుర్వేద బిలీవ్స్ ఇన్ ప్రివెన్షన్ ఫస్ట్. 60% ఆయుర్వేద బుక్స్ టెల్ అబౌట్ ప్రివెన్షన్ ఓన్లీ, దెన్ కమ్స్ ట్రీట్మెంట్. సో స్వస్థస్య స్వాస్థ రక్షణం, ఆతురస్య రోగ ప్రశమనం. సో ఫస్ట్ పాయింటే ఫస్ట్ టు ప్రివెంట్, హౌ టు ప్రివెంట్ ద డిసీజ్. సో క్లియర్లీ దే హ్యావ్ టోల్డ్ ఇన్ అష్టాంగ సంగ్రహ, చరక సంహిత, సుశ్రుత సంహిత. దే స్టార్ట్ విత్ డైలీ రెజిమెన్, దెన్ సీజనల్ రెజిమెన్, దెన్ యాన్యువల్, మొత్తం సంవత్సరంలో ఎట్లా చేయాలి. సో ఇవన్నీ చాలా క్లియర్గా చెప్పారు. పొద్దున్న ఎన్ని గంటలకు లేవాలి, పళ్ళు ఎలా తోముకోవాలి, ఆహారం ఎలా తినాలి, రోజు తలకు నూనె పెట్టుకోవాలి, ఇవన్నీ చాలా క్లియర్గా చెప్పారు. ఈ రోజుల్లో ఎవరు పాటిస్తారు? బిఫోర్ ద సన్ రైజ్ యూ షుడ్ గెటప్. మనం సన్సెట్ అయినాక తొందరగా పడుకోవాలి భోజనం చేశాక. ఇందాక మేడం చెప్పారు స్లీప్ ఆప్నియా, ఇవన్నీ చాలా రోగాలు. ఇఫ్ యువర్ స్లీప్ ఈజ్ నాట్ కరెక్ట్, you will end up not only with pulmonary diseases, you will end up with gastric diseases, constipation. Then one constipation is enough to destroy your whole health. So that is the reason Ayurveda give emphasis in digestive system, stomach. So when your stomach is good, your sleep is good, automatically you will be relieved of all type of chronic diseases. Chronic diseases and pain management చెప్పుకుంటున్నాం. సో ఆర్థరైటిస్. సో లాట్ ఆఫ్ బికాస్ ఆఫ్ మనం ఏదైనా యాంటాసిడ్స్ ఎక్కువ తీసుకుని నిద్ర లేకపోవడం వల్ల ఎసిడిటీ వస్తుంది. ఎసిడిటీ కోసం యాంటాసిడ్ తీసుకుంటాం. యాంటాసిడ్ తీసుకుంటే మన కాల్షియం అబ్జార్ప్షన్ సరిగా అవ్వదు. కాల్షియం అబ్జార్ప్షన్ సరిగా కాకపోతే ఆస్టియోపోరోసిస్, బొక్కలు అరిగిపోవడం, తొందరగానే అరిగిపోవడం. తర్వాత విటమిన్ డికి ఎక్స్పోజ్ కాం మనం. అని ఇలాంటి ఏసీఆర్లో కూర్చుంటే ఎండ ఎక్కడ వస్తుంది, విటమిన్ డి ఎక్కడ ఫామ్ అవుతుంది. సో దీస్ థింగ్స్ ఇవి ఎప్పుడైతే మనం ఇవన్నీ సెట్ చేస్తామో ఆటోమేటికలీ క్రానిక్ డిసీజ్ అన్నీ సబ్సైడ్ అయిపోతాయి.
వెన్ యువర్ అంటే మీరు ప్రాక్టీస్ స్టార్ట్ చేసినప్పుడు ఆయుర్వేదం అనేది అంత నోన్ టాపిక్, అంటే లాంగ్ బ్యాక్ ఆయుర్వేదం ఫాలో చేసి ఉండొచ్చు. బట్ లాస్ట్ 50 years అంటే మోడర్న్ మెడిసిన్ డెవలప్ అయిన తర్వాత ఎర్లీ 80s ఆర్ సంథింగ్ ఇంతగా పాటించడం కానీ ఇది లేదు. నౌ అంటే షిఫ్ట్ అనేది ఒకటి కనిపిస్తూ ఉంది. ఈవెన్ కార్పొరేట్ హాస్పిటల్స్లో కూడా ఆయుర్వేద సెక్షన్స్ వచ్చినాయి. సో మోడర్న్ మెడిసిన్ తోటి ఆయుర్వేదం అనేది ఇంటిగ్రేట్ అయి వెళ్తుంది అనుకోవచ్చు.
డెఫినెట్లీ అండి. ఆఫ్టర్ కరోనా స్పెషల్లీ అండ్ బిఫోర్ కరోనా ఆల్సో, ఇప్పుడు మీరు చూసారా నంబర్ ఆఫ్ జిమ్స్ ఎన్ని ఎక్కువ అయ్యాయో. నేను ఇంటర్మీడియట్ చదివేటప్పుడు 10th చదివేటప్పుడు జిమ్ అంటే ఏదో ఒక లగ్జరీ ఐటమ్. ఇప్పుడు గల్లీకో జిమ్ ఉంది. బికాస్ హెల్త్ కాన్షియస్ ప్రివెన్షన్ ఆస్పెక్ట్ ఈజ్ becoming a very big thing. And after corona, prevention of diseases is become a very big, and lifestyle disorders. So lifestyle, food, ఇవన్నీ ఎందుకు వస్తున్నాయంటే ఫస్ట్ దే నో, ఫస్ట్ ప్రివెంట్ చేస్తే తర్వాత క్యూర్ వరకు వెళ్ళక్కర్లేదని. సో ఇదంతా కూడా ఆయుర్వేదంలో ఎప్పటి నుంచో చెప్పబడి ఉంది. సో అవి ఇప్పుడు వాళ్ళు కొంచెం అబ్జర్వ్ చేశారు. అండ్ స్పెషల్లీ ఆఫ్టర్ 2017 అండ్ ఇన్ ఇండస్ట్రీ కూడా ఆఫ్టర్ రామ్దేవ్ బాబాస్ ఆల్ దీస్ థింగ్స్ అండ్ యోగా ఇవన్నీ ప్రాక్టీసెస్ ఇవన్నీ రావడం వల్ల అవేర్నెస్ బాగా క్రియేట్ అయింది. అండ్ నాన్ ఇన్వేజివ్ అంటే లైఫ్ స్టైల్ మార్చుకుని ఫుడ్ మనం చేంజెస్ చేసుకుని మన హెల్త్ని ఎలా కాపాడుకోవాలి ఇవన్నీ చాలా క్లియర్గా చెప్పారు. అందుకే ఇప్పుడు ఆయుర్వేదం వైపు చాలామంది షిఫ్ట్. నాట్ ఓన్లీ యూ కెన్ టెల్ ఆయుర్వేద, నేచురోపతి ఆర్ న్యాచురల్ థింగ్స్, పీపుల్ ఆర్ షిఫ్టింగ్ బికాస్ దే డోంట్ వాంట్ టు గెట్ ఇన్ టు ద డిసీజ్ సిస్టమ్.
ఓకే మస్తాన్ గారు, మీరు అంటే మీరు సొంతగా డెవలప్ చేసినటువంటి ఫార్ములేట్స్ కానివ్వండి, లేకపోతే పెయిన్ అనేది ఎక్కువ మంది ఎవ్రీ వన్ ఫేస్ చేసినటువంటి ప్రాబ్లం. సో మోడర్న్ మెడిసిన్లో వీటికి పిల్స్ కాంబినేషన్ ఆఫ్ ఎక్కువ కెమికల్ ఉంటుంది. సో బట్ రిజల్ట్ అనేది కనిపిస్తుంది. అంటే దానికి కాకుండా వేరే ఆల్టర్నేటివ్ మెథడ్ ఏంటి పెయిన్ని డీల్ చేయడానికి?
గుడ్ ఆఫ్టర్నూన్ ఎవ్రీవన్ అండి. ఫస్ట్ ఆఫ్ ఆల్ థ్యాంక్స్ టు ABP network team as a part of here. So pain management అనేది unpleasant discomfort basically is the maximum pains are mechanical nature. సో ఈ మెకానికల్గా యాంత్రికమైన జీవన విధానంలో ప్రతి ఒక్కరికి మెకానికల్గా ఎంతో కొంత ఈ మస్కులోస్కెలిటల్ డిజార్డర్స్, మస్కులోస్కెలిటల్ ఇంజురీస్ వీ కాల్డ్ యాజ్ ఏ రిపిటేటివ్ స్ట్రెస్ ఇంజురీస్ అనేటివి కామన్గా వస్తూ ఉంటాయి. దీనికి మనము ట్రీట్మెంట్ పాయింట్ ఆఫ్ తీసుకుంటే మాత్రం ఖచ్చితంగా మనకు ఆ లైఫ్ స్టైల్లో జరిగిన ఎర్రర్స్ వల్ల వచ్చింది కాబట్టి అక్యూట్ పెయిన్ ఉన్నప్పుడు మాత్రం చాలామంది పెయిన్ కిల్లర్స్ మీద ఎక్కువ మొగ్గు చూపుతారు. పెయిన్ కిల్లర్స్ అనేటివి ఎక్కువగా వాడటం వల్ల ఇట్ లీడ్స్ టు ది, ఇప్పుడే మనకు రెనలెక్స్ అధినేత ఒక అతను వచ్చి CKD గురించి ఎక్స్ప్లెయిన్ లాట్ అబౌట్ ది రీనల్ కిడ్నీ డిసీజెస్. సో ఇవి చాలా కాంప్లికేటెడ్గా పెయిన్ కిల్లర్తో బిల్డ్ అవుతాయి. So painkiller, it is an instant relief. Then what is the long-term benefit? So naturalగా మనము ఆ పెయిన్ ఎలా డెవలప్ అయ్యింది అనేది ముందు వీ హ్యావ్ టు అండర్స్టాండ్. వీ హ్యావ్ టు అండర్స్టాండ్ ది బాడీ ఇంటెలిజెన్స్ టువర్డ్స్ ద నేచురల్ వే ఆఫ్ హీలింగ్ ప్రాసెస్. దెన్ ఓన్లీ యూ విల్ గెట్ రిడ్ ఆఫ్ ఇన్ న్యాచురల్లీ అండ్ లాంగ్ టర్మ్ బెనిఫిట్. సో దాన్ని అసెస్ చేసుకోగలగాలి, బాడీ ఇంటెలిజెన్స్ ఎలా ఉంది, వాళ్ళ మసిల్ నేచర్ ఎలా ఉంది, మజిల్ స్ట్రెంగ్త్ ఎలా ఉంది, సో నేచర్ ఆఫ్ ఇంజరీ ఎలా డెవలప్ అయింది, మెకానికల్గా డెవలప్ అయిందా లేకపోతే ఎక్కడైనా స్కిడ్ అయ్యా, స్ప్రెయిన్ అయ్యా, స్పోర్ట్స్ ఇంజరీ, అవన్నీ డయాగ్నోస్ చేసుకున్న తర్వాత నేచురల్ థెరపటిక్ అప్రోచెస్ చాలా ఉన్నాయి. లైఫ్ స్టైల్ మోడిఫికేషన్ చేసుకోవటం, రీహాబిలిటేషన్ చేసుకోవటం, తర్వాత సింపుల్గా చాలా అక్యూట్ పెయిన్స్ని సింపుల్గా హైడ్రోథెరపీ టెక్నిక్స్తో మనం బాగా తగ్గించుకోవచ్చు. పర్టికులర్గా కోల్డ్ అండ్ హాట్ వేరియేషన్స్తోనే పెయిన్, అక్యూట్ పెయిన్ కూడా మనం తగ్గించుకునే టెక్నాలజీ సైంటిఫిక్గా కూడా బాగా ప్రాచుర్యం పొందింది. ఇవన్నీ కూడా పెయిన్ కిల్లర్స్తో ఎంత రిలీఫ్ వస్తుందో న్యాచురల్ థెరపీస్తో కూడా అంతే రిలీఫ్ వస్తుంది. అది కాకుండా న్యాచురల్గా తగ్గే ప్రతి పెయిన్ కూడా లాంగ్ టర్మ్లో అది రెసిస్ట్గా బిల్డ్ అవుతుంది. అంతేగాని పెయిన్ కిల్లర్స్ ఇట్ ఈస్ ఓన్లీ ఇన్స్టెంట్ విచ్ ఈజ్ అన్ అక్యూట్. ఫర్ ఎగ్జాంపుల్ సర్జికల్ పెయిన్స్ ఉంది, సో దాన్ని మనము ఆ సర్జికల్ పెయిన్స్ని మనము ఖచ్చితంగా పెయిన్ కిల్లర్స్తో మేనేజ్ చేయాల్సి వస్తుంది. ఎనీ మెడికల్ రిలేటెడ్ పెయిన్ ఉంది, సో దానికి కంపల్సరీ మనము వీ హ్యావ్ టు టేక్ ఇన్ టు ద పెయిన్ కిల్లర్స్. వేరేజ్ ఇన్ ద మెకానికల్ పెయిన్ ఆర్ యాంత్రికంగా డెవలప్ అయ్యే ఈ బ్యాక్ పెయిన్ కావచ్చు, స్పాండలైటిస్ కావచ్చు, ఆర్థరైటిస్ కావచ్చు, డయాబెటీస్లో ఫ్రోజన్ షోల్డర్స్ కావచ్చు, ఇవన్నిటికి కూడా లాంగ్ టర్మ్ పెయిన్ కిల్లర్స్ ఈజ్ నాట్ ఎట్ ఆల్ అడ్వైస్.
అంటే లైఫ్ స్టైల్లో భాగంగా వచ్చేటువంటి పెయిన్స్ తోటి మనం లైఫ్ స్టైల్ని చేంజ్ చేసుకోవడం వల్ల డీల్ చేయొచ్చు అని చెప్తున్నారు. బట్ అలా కూడా తగ్గని వాటిని అపార్ట్ ఫ్రమ్ మోడర్న్ మెడిసిన్, ఈజ్ దర్ ఎన్ ఆయుర్వేదిక్ మెడిసిన్ టు డీల్ ద పెయిన్?
యా, ఆయుర్వేద అండ్ న్యాచురోపతి బోత్ ఆర్ ఈజ్ బ్రదర్ అండ్ సిస్టర్స్. ఇక్కడికి వచ్చే కొందికి పెయిన్ కిల్లర్స్ అనేవి పక్కన పెడితే న్యాచురల్గా ఇప్పుడు ఫర్ ఎగ్జాంపుల్ ఐ డెవలప్డ్ ఇన్ టు ద మై డాక్టర్ పెయిన్ రిలీఫ్ ఆయిల్, దట్ ఐఎమ్ ద ఫౌండర్ ఆఫ్ దట్ ప్రొడక్ట్. సో అది ఎక్కడికో ఎంతోమందికి అది యూజ్ అవుతుంది. ఒక పెయిన్ రిలీఫ్ ఆయిల్ని ఎక్స్టర్నల్గా అప్లై చేసుకోవటం వల్ల పెయిన్ అనేది తగ్గకపోతే దానికి ఆ ప్రాచుర్యం రాదు, ఎంత మార్కెట్ చేసినా కూడా సాచురేషన్ వచ్చేస్తుంది ఎక్కడో దగ్గర. బట్ అది యాంటీ ఇన్ఫ్లమేటరీగా సూపర్ఫిషియల్గా పనిచేసినప్పుడు పెయిన్ రిలీఫ్ ఎప్పుడైతే వస్తుందో వాళ్ళకి ఆ పర్సనల్గా వాళ్ళ కాన్ఫిడెన్స్ లెవెల్స్ బాగా బిల్డ్ అవుతాయి. పెయిన్ ఫ్రీ అయితే ఈ యాంటీ ఇన్ఫ్లమేషన్ కండిషన్ తగ్గినప్పుడు అలాంగ్ విత్ ఈ ఎక్స్టర్నల్ అప్లికేషన్ దెర్ ఈజ్ సమ్ లైఫ్ స్టైల్ చేంజెస్ అండ్ కన్జర్వేటివ్ ట్రీట్మెంట్స్, వీటిని మనం ప్లాన్ చేసుకుంటే ఖచ్చితంగా దట్ ఈస్ ద అక్యూట్ యాజ్ వెల్ యాజ్ ఇన్ ద క్రానిక్ పెయిన్ కూడా మనము అంటే బాడీకి ఉన్న ఆ ఇంటెలిజెన్స్ టెక్నాలజీని మనం ఉపయోగించుకోగలిగితే మాత్రం ఖచ్చితంగా పెయిన్స్ అన్నీ కూడాను జీరో లెవెల్కి వచ్చే అవకాశాలు ఎక్కువగా ఉన్నాయి. 25 years నుంచి వితౌట్ ఎనీ మెడిసిన్స్ పర్టికులర్లీ ఇన్ ద పెయిన్ కిల్లర్స్ లేకుండా మనం ఈ హీలింగ్ హస్తా దగ్గర నుంచి నేను ప్రాక్టీస్ చేస్తూ ఉన్నాను. వీఆర్ గెటింగ్ లాట్ ఆఫ్ ఫీడ్బ్యాక్, క్రెడిబిలిటీ బిల్డ్ అయింది. పేషెంట్స్ చాలామంది దే ఆర్ ఫ్రీ ఫ్రమ్ ఆల్ సైడ్ ఎఫెక్ట్స్.
రామకృష్ణ గారు, అంటే ఆయుర్వేదంలో ఉన్నటువంటి అడ్వాంటేజ్ అంటే స్లోగా తగ్గినా ఇన్స్టెంట్ రిలీఫ్ రాకపోయినప్పటికీ కూడా అంటే సైడ్ ఎఫెక్ట్స్ లేకపోవడం, లాంగ్ టర్మ్ బెనిఫిట్స్ ఉండడం, వీటి వల్ల ఎక్కువ మంది దాని మీద కాన్సన్ట్రేట్ చేసేటువంటి పరిస్థితి వచ్చింది. సో ఇండియాలో ఆయుర్వేద అనేది పాపులర్ ఓవర్ ది జనరేషన్స్, ఇట్ ఈస్ పాపులర్ కదా. సో గ్లోబల్గా ఎలా రీచ్ వస్తుంది? ఎందుకంటే మీరు చాలా వరకు ఫార్మా కంపెనీస్తో అసోసియేట్ ఉన్నారు, గ్లోబల్ ఫార్మా కంపెనీస్తో కూడా అసోసియేట్ ఉన్నారు. సో గ్లోబల్గా ఎలాంటి రీచ్ వస్తుంది, యాక్సెప్టెన్స్ ఎలా వస్తుంది, ఆయుర్వేదాన్ని గ్లోబల్గా ఎలా చూస్తున్నారు?
ఆయుర్వేద ఈ మధ్య కాలంలో బికాస్ 2017 నుంచి కంపెనీస్ లైక్ జిఎస్కే, ఇప్పుడు మీరు ఆర్టర్విన్ చూస్తున్నారు, జిఎస్కే, అయోడెక్స్, ఈనో, దీస్ ఆర్ ఆల్ ప్రొప్రైటరీ ఆయుర్వేదిక్ ప్రొడక్ట్స్. అండ్ నాట్ ఓన్లీ దిస్, నేను ఎందుకంటే ఐఎమ్ ఎ కన్సల్టెంట్ ఫర్ జిఎస్కే ఆల్సో, సో వీఆర్ డెవలపింగ్ న్యూ ప్రొడక్ట్స్ ఫర్ గ్లోబల్ రీచ్. ఎందుకంటే దే ఆర్ లుకింగ్ ఫార్వర్డ్ ఆన్ ఆయుర్వేద బికాస్ ఆయుర్వేద ప్రిన్సిపల్స్ అండ్ టు గెట్ ఇన్ నియర్ టు నేచర్. అండ్ మీరు అన్నారు హోలిస్టిక్ వే అప్రోచ్, ఇప్పుడంతా హోలిస్టిక్ వే అండ్ పర్సనలైజ్డ్ మెడిసిన్స్ ఇవన్నీ చాలా వస్తున్నాయి. అండ్ మెనీ కంపెనీస్ అండ్ మెనీ ఎంఎన్సీ కంపెనీస్ ఆర్ టర్నింగ్ టువర్డ్స్ ఆయుర్వేదిక్ ప్రొడక్ట్స్, స్పెషల్లీ హెర్బల్ ఆరిజిన్ ఎక్స్ట్రాక్ట్స్, ప్లాంట్ ఎక్స్ట్రాక్ట్స్, బికాస్ ప్లాంట్ ఎక్స్ట్రాక్ట్స్ ఆఫ్ హోలిస్టిక్ వే, అంటే ఓన్లీ దానిలో ఏదో ఒక యాక్టివిటీ తీసి దానిపైన క్లినికల్ ట్రయల్స్ కాకుండా యాజ్ ఎ హోల్సమ్ మెడిసిన్. అండ్ గ్లోబల్ population is really looking towards Ayurveda because we are looking now, industry is growing like that. Exports are చాలా ఎక్కువ ఈ మధ్యన మన ఆయుర్వేదిక్ ఎక్స్ట్రాక్ట్స్ కానీ ఆయుర్వేదిక్ బ్లెండ్స్ ఇవన్నీ కూడా ఆయుర్వేదానండి లేదంటే దట్ మే బి ఫుడ్ సప్లిమెంట్స్ ఆల్సో ఎఫ్ఎఫ్ఎస్ఐలో కూడా మెనీ ఆయుర్వేదిక్ products have been incorporated and they are getting exported.
సో యు ఆర్ ఇన్ ప్రోడక్ట్, మీరు ప్రోడక్ట్ డెవలప్ చేశారు, ప్రోడక్ట్ మార్కెటింగ్ చేస్తారు, ఇవన్నీ ఉన్నారు. సో హౌ డు యూ సీ అంటే వరల్డ్లో భారత్ ఆయుర్వేద ప్రొడక్ట్స్కి ఎలా ఉండబోతుంది? ఆల్రెడీ రామ్దేవ్ పతంజలి ప్రొడక్ట్స్ అని గ్లోబల్ స్టేజ్కి వెళ్ళాయి. ఇంకా రాను రాను ఈ మార్కెట్ అనేది ఎలా స్ప్రెడ్ అవబోతోంది? గ్రాడ్యువల్లీ ఇంక్రీజింగ్ కదా, ఎలా చూస్తారు రాబోయే రోజుల్లో ఎలా ఉందనేది?
చాలామంది ఇప్పుడు నా వరల్డ్ ఈజ్ బ్యాక్ టు నేచర్. చాలామంది కూడా సైడ్ ఎఫెక్ట్స్ లేకుండా చాలా ఈజీగా బాడీకి ఉన్న ఆ న్యాచురాలిటీ హీలింగ్ ప్రాసెస్ మీద ఎక్కువ మక్కువ చూపుతున్నారు. బికాజ్ ఆఫ్ కరోనా తర్వాత మనం ఆలోచిస్తే చాలామంది కరోనాకి చాలామంది సఫర్ అయ్యాం, ప్యానిక్ అయ్యాం. ఈ టైంలో ఎన్ని మెడిసిన్స్ ఇచ్చినా ఫైనల్గా వాళ్ళు ఒకటి కాంబినేషన్ చెప్పింది ఏంటంటే ఇమ్యూనిటీ ఎవరిలో అయితే బాగా బలంగా ఉంటుందో ఆటోమేటిక్గా వాళ్ళకి ఆ కరోనా నుంచి దూరం ఉంటారు, కరోనా కాంప్లికేషన్స్ని బాగా తగ్గించుకోవచ్చు. దాంట్లో మనం సి విటమిన్ని బాగా ప్రమోట్ చేశారు. బికాస్ ఆ నేచురాలిటీలో ఉన్న ఆ నేచర్స్ హెర్బ్స్ కావచ్చు, లేకపోతే న్యాచురల్ మెడిసిన్స్, ఇవన్నీ కూడా రాబోయే రోజుల్లో బాగా పాపులర్ అవుతుంది. ఇంకొకటి ఏంటంటే మన ఇండియాలో ఈ ఆయుర్వేదం న్యాచురల్ మెడిసిన్స్ ఇంత డెవలప్ అయి ఉండి కూడా మనం ఒక నోబెల్ ప్రైజ్ తీసుకోలేకపోవటం మనకు చాలా బాధ కలుగుతుంది. అదే చైనా TCM ట్రెడిషనల్ చైనీస్ మెడిసిన్ ఆర్టిమస్ మీద మన మలేరియా మీద నోబెల్ ప్రైజ్ 2015లో తీసుకున్నారు, తూ యూ అనే సైంటిస్ట్. అలాగే మీరు ఫాస్టింగ్ థెరపీ, వన్ ఆఫ్ ది బెస్ట్ న్యాచురోపతి థెరపటిక్ అప్రోచ్, దట్ ఈస్ another 2016 Japanese scientist is taken to the Nobel Prize. There is a lot of scientific evidence as a natural medicines. దాన్ని స్ట్రీమ్ లైన్లోకి తీసుకొని ఇప్పుడిప్పుడు బాగా ఎవల్యూషన్, ఎందుకంటే డిమాండ్ ఎప్పుడైతే పెరుగుతుందో ఆటోమేటిక్గా దాని మీద రీసెర్చ్ కూడా బిల్డ్ అవుతుంది. బిల్డ్ అయినప్పుడు ఖచ్చితంగా వాటి యొక్క వాల్యుయేషన్ పెరుగుతుంది, వాటి యొక్క యూసేజ్ పెరుగుతుంది, ప్రొటెక్షన్ ఆఫ్ ది హ్యూమన్ లైఫ్ ఎక్కువగా మనకు బిల్డ్ అవ్వడానికి అవకాశాలు ఉంటాయి.
థ్యాంక్ యూ సార్. థ్యాంక్ యూ డాక్టర్.
థ్యాంక్ యూ. థ్యాంక్ యూ.
Thank you. This is going to be a live session where we'll all join in together. We'll not start until all of you are settled. So people at the back, please come forward and be seated. People to my right. Students, I request you all to settle down. Kindly take your places. Come on, everybody, let's sit down. In the next 10 minutes, we'll all break for lunch. We'll also wind up with a final session for today. So I would request all of you to please take your seats, occupy the front rows. Kindly be seated at your respective places. This is going to be a live session and it's going to be interesting. And also your participation would be the key for it. So I would want you, people at the back, guys, the people standing near the table, can you all please be seated? Thank you so much. All right, so proceeding towards the final session of today, from boardroom to breathe work. boosting focus and wellness with office yoga. We have a live yoga session with Lakshmi here with us today. So can we give Lakshmi Yalamudi a big round of applause? She is the yoga and Pilates coach here with us today for a live session. So kindly participate and let's make this an interactive one. Let's welcome Miss Lakshmi with a huge round of applause, people.
Hello everyone, good afternoon. Are you all here? Everybody is stuck with mobiles and scrolling and all, isn't it? Yeah, so we are going to re-energize ourselves and refocus ourselves in another 10 minutes. Are you all ready? Ready? I couldn't hear anything. Are you all ready? Very good, now I could hear, yes. So before going to start the session, let me just ask a quick question that can you all define in one word that how you are feeling now? Just in one word that how you are feeling about your body, rigid, tired, tensed, or dreaming about your lunch? Lunch? And? Only lunch? Nobody speaking. Just lunch? Okay, so whatever it is, either tight or tensed or whatever you are feeling now, we are going to just avoid all those things and just re-energize ourselves, right? So just quickly stand up wherever you are now. Just stand up. Yes. So are you all focused? Focused? Are you all in the present? So let me just quickly check your presence of mind. So I'll just show a quick demonstration that where you are going to place your both hands like this, facing towards the face. Yes. So now you're going to rotate your right hand in the clockwise direction. Right hand only. Now the left hand in anti-clock direction. Come on. How many of you are able to do? Right hand in the clock, left hand in anti-clock. I could see both in one direction. Is your body doing whatever the mind is saying? Is it? No, right? How many of you are thinking that you are doing in right way? I could see no one. Yes, very good. Relax. You can sit. So, this means that we are unfocused. Why are we unfocused? We are stuck with either the past or the future, isn't it? So most of the times, 95% will be stuck with either the future or the past, right? So that happens because of this fast-paced lifestyles and we are running behind the time. In a day, from the time that you wake up till you go to the bed, we are running behind. It's like a race, right? So in between, we are just missing that focus. Now, coming to the physical body. How many of you are sitting, whether you are a working professional or a student, how many of you are sitting for about more than 5 to 8 hours? Yes. How many of you are experiencing back discomfort? Hardly at the age of 18, 25, between 18 and 25, you're experiencing the back discomfort. Right? Any of your family member experiencing like cervical issues, spondylitis, or maybe like lower back issues, sciatica and all? Raise your hand. Any of your family members experiencing, right? So nowadays, when it comes to our yoga studios, people are coming to us with a lot many spinal related issues, and they are just working for about 9 to 10 hours at the desk, doing nothing, but they are developing the back related issues, right? So our physical body and the mind also going to affect with the sedentary lifestyles and all. That we are going to be out of with the yoga practice, right? So when it comes to yoga, again, even a few professionals spoke about it just before. 10 to 15 minutes of physical exercise. When I say exercise, it's not like going to a gym and spending hours and hours, and not like going to studio also even for yoga, 10 to 15, 1 hour or 2 hours and all. Just being at your desk also, not even at your home. Desk, wherever you are, whether you are a student or a working professional, being at the desk, you can just practice a quick moves and breath work can heal you physically and mentally, and it can make you focused and improve your health. That is what we are going to do now. Are you all ready? Ready? Come on, now let's stand up once again. Stand up. You can maintain the little distance between yourself so that it is easy for you to move. Just like this only, whenever you are studying, when in your college or when you are at workplace, between like 1 hour to 2 hours, you can just stand up for 2 to 3 minutes and you can have a quick moves. Now, raise your both hands up. Interlock the fingers over the head. Interlock the fingers over the head. As I'm holding the mic, I could not show you, but yes. Now raise the heels up. Raise your heels up. Raise your heels up and try to balance. Gaze at one point. Focus. Be focused. Come on, ma'am. Very good. Now can you walk a step forward? I know there are tables, but yes, make a move a little and make a move a little bit back. Good. Now raise the hands up. Up. Keep stretching as if you are trying to touch the ceiling. It is impossible, but imagine. Yes. Now heels down. Come on, come on. Again up. Heels up and heels down. Heels up and down. Heels up and down. Heels up and down. Now up and hold. Stay in the pose. Up and hold. Stay there. Now smile. Yes. Stay over there. Very good. Now keep the hands over there only. Chest. Heels down. Now bend towards the right side, laterally. Another side. Bend laterally, not a forward bend. Bend laterally. Then breathe in, come back to center. Breathe out. Another side you can bend. Breathe in to center, breathe out to another side. This gives a nice stretch to your spine. As it is going to align your spine again so that you will avoid many spinal related issues. I didn't say to stop the practice. Come on, hold on one side now, everyone. Stay in the pose. Breathe. And slowly breathe in, come back. Breathe out, bend to another side. Perfect. And relax. How are you feeling? How are you feeling? Relaxed? Stretched? Now another one. Keep your both palms on your waist. On your waist. Now, push your waist forward and gently arch back. And look at the ceiling. Don't close your eyes. You tend to fall. Like that. Bend. And come back. And again, arch. Nice. And come back. Now, breathe in once again, last. Bend back. Feel nice over your back. Now breathe in, slowly come back. Good. This is a nice flexion to your back, which will keep your spine at ease when you are sitting for a longer hours in a poor posture. Now, again, raise your both the hands over the head. Both the hands up as you inhale. Now, with the exhalation, you can slowly bend forward. Breathe in, slowly come up. Breathe out, slowly bend forward. Breathe in, bend up. Again, raise up, raise up, raise up. In sync. Breathe out, bend. Breathe in, raise up. Breathe out and bend. Again, breathe in, raise up. Tired? Just with the 2 movements. Yes, get up. Again, come to standing position. Now stretch your both the hands forward. Both the hands stretch forward. Now, it's a nice twist to your spine, and it is going to activate your digestion system also. There are many professions spoke about, like the diabetes, even at the age of 20, even before only, right? We can avoid all those issues with the quick twisting postures, as you can just stretch the hands forward, twist. Twist one hand on your lower back, other hand on the shoulder. One more time, you can see. Exhale to the other side. Very good. Twist, twist more. And inhale to the center. Exhale to another side. Twist. Inhale to the center. Very good. And relax. How are you feeling? The spine and your body? Feeling energized? Now you sit. The last one is for your mind. Just a quick breath work. In order to control all the emotional imbalances, just breathe in and breathe out for about 4 times fast. And then in the last, you're going to breathe in and hold the breath for about 1 time. Okay? Just breathe in, out. Breathe in, out. Breathe in, out. Breathe in, out. Now breathe in, hold the breath, hold the breath, hold, and breathe out. Once again, breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in and breathe out. Now breathe in and hold. Hold the breath and breathe out slowly. Relax. How are you feeling? Feeling calm? Yes. With this quick breathing and stretches and all, no, you can maintain your physical and mental wellness. If you can spend at least 10 minutes in between the work also, it is enough. Right? So thank you so much for showing up for your brain.
Thank you so much, Lakshmi, for a wonderful session. I think the fact that everybody has participated and actively been there, I think this itself speaks volume. Thank you once again, Lakshmi. And I would now request Vidya, Regional Sales Head South, to kindly step forward. Let's honor Lakshmi for being here today. Can we give Lakshmi a huge round of applause, everybody? To all the students and the entire management who've been here making this ABP Desam Health Conclave 2025 a successful one. Thank you everyone for your active participation. You may now proceed, go ahead, have your lunch and have a safe journey back. Thank you once again. This is your host Simran Mulchandani signing off, and all the very best to all of you. Call for all the ABP team members. Can we have all of you onto the stage for a group photograph? Thank you. Let's capture this moment and let's cherish the memories forever. Thank you once again. Team, please join in for a group photograph.
Thank you.